welcome everybody. So happy to have you guys joining us for Willow House's presentation of our healthcare seminar today on grief and COVID. My name is Lauren and I'm the program director at Willow House. I'm a licensed clinical professional counselor and a registered art therapist. And Willow House is a nonprofit organization that provides grief support services to children, families, schools, and community organizations that are coping with the death of a loved one. We offer peer support groups for children as young as 3 years old, all the way up to young adults who have lost a sibling or a parent. And for our adults, we also have a spouse loss and a child loss group. In addition, we also have an expressive arts group that meets for the entire family. And then we also have a survivors of suicide loss group. Willow House can provide consultations, professional development trainings like we're doing today, and resources and referrals for schools and the community. This presentation is able to be held today from a really generous funding from the Lake County CARES grant. So thank you to Lake County for this opportunity for allowing us to spread the knowledge of grief and loss to all of you. And now I want to welcome you to our presenters today, Willow House's senior trainers and the co-founders of the Satori Group, Dr. Pamela Gabay and Andy McNeil. Dr. Gabay is a childhood bereavement consultant, former director for the Morning Star Center for Grieving Children. She also served on the board of directors for the National Alliance for Grieving Children. Dr. Gabay served as president of the Southern California chapter of the Association for Death Education and Counseling. And Pamela is also a trainer for the American Foundation of Suicide Prevention. And then we have Andy McNeil, who has provided executive leadership on the National Alliance for Grieving Children, the Amelia Center at Children's of Alabama, and Treasure Coast Hospice in Florida. He also has experience in business development, providing education and consultation and nonprofit management. He is a trainer for the Boys and Girls Club of America and the American Foundation for Suicide Prevention. And together they are the co-authors of Understanding and Supporting Bereaved Children, a practical guide for professionals. So I want to welcome the two of them, as well as allow two of our other staff members at Willow House to introduce themselves that will be kind of on our panel this morning and into the afternoon. Michaela?
Morning, everyone. My name is Michaela Badinian. I am a program and office coordinator for Willow House. I will also be helping out today on the tech end. So if you have any tech questions or need any guidance, you can send me a private chat in the Zoom chat that is found at the bottom of your screen, and I will be happy to help. I'm so glad you're all here today.
Thanks, Michaela. And Barb?
Hi, I'm Barb Brandt. I'm a licensed clinical counselor and I'm helping out with Willow House. I co-facilitate the Survivors of Suicide group.
Thanks, Barb. And just a moment of housekeeping, which we'll reiterate at the end as well, that you guys will be receiving an email from CEGO after this presentation to fill out a survey. If you are receiving CEUs from today, that once you fill out the survey, you'll then be able to download your certificate for CEUs. So look out for that later this afternoon. But from here, I'm going to go ahead.
Lauren, I was going to say the PowerPoint slides will also be available when you fill that out. You'll be able to get the PDF of the slides.
Thank you, Pamela. And handing it over to you guys.
Awesome. Well, thank you. Thanks so much, Lauren. Again, we'll just say our thanks to Willow House for hosting this, and for Lake County for the grant, and for sponsoring and funding this. Over the last 2 months, we've been able to do a number of these presentations, and I know a number of professionals have been able to be educated, but also receive CEs. Which is always awesome as you end out your year, and to get those extra CEs that we know that we need in our professions to maintain our licenses and continue to do the good work that we do. So our thanks there for that. So today, we're going to focus on healthcare, very specifically healthcare professionals. Before we get too far into it, though, I have to say, if we were all in person and together, we would start the day by putting up a large, maybe, I don't know, 20 by 30 sized picture that maybe has words all over it that reflect how we are all feeling about COVID at this point. And maybe we would have, I don't know, 10 dozen eggs, and we would just all take turns just pelting that big, picture of all of those things that COVID is. I don't know about the rest of you, but for me, it just feels like we've already had such a long journey. And I will say, I've been having a number of conversations with colleagues and just in different settings. And if I have heard it once, I've heard it 100 times in the last 2 weeks. I can't wait until 2020 is over and we can get into 2021. And I understand that sentiment. One of the things that concerns me with that sentiment is I've also seen over the years with grieving people who just had a rough year and they want to get into the next year. And it's almost like the hope is that the new year is going to bring, a sense of renewal and all of those things that we know comes with it. But I also know that on the other side in January, so many grieving people then come to me and say, Andy, I thought it was going to be different. And so one of my fears is that we get through the new year and we get into January and we're all saying, really? Like it's still, like how long? And so I guess I just start by thinking of the word endurance. How do we hang in there? And then just hearing news reports of things continuing to escalate. So we are going to spend some time today. We're going to be all together. We're going to be together the next 4 hours. So we have to get comfortable with each other. We have to be willing to share and interact. Pamela and I have some slides and we're going to go over those, but we want to be able to have a conversation with all of you. What you're seeing, what you're experiencing. The nurses and physicians that you work with, what are you seeing for them? Those of you who work in healthcare facilities, there might be social workers or chaplains or counselors or other professions. What is your experience? What are you encountering? And how do we endure together? How do we support one another? What of all of this is related to grief? And how do we manage and deal with those things? So a number of things that we'll go over in our time here together today. Pamela, I didn't know if you had any just opening remarks, and then we'll kind of pull the slides up and get things going here.
Yeah, thank you, Andy. I am grateful actually to see so many of you on today. Quite a few of you were on with us yesterday when we had the full day advanced bereavement training. So welcome back today. And then quite a few of you are friends and colleagues from around the country. So hello to all of you. So glad to see you. And then there are some new faces that are new to me. So I'm glad to get to know you in this time we have together. We really want this time to be about learning together, but we also really want it to be an opportunity for all of you to have a chance to debrief some, to talk about your experience, to talk about really how 2020 has been, not only for you professionally, but if you wanted to share in any ways personally. It's interesting because so many of you might be experiencing what Andy and I and Lauren and Michaela and Barb have been experiencing, that we hear, people saying, well, I'm working less, or I enjoy working remotely, or, there's all of these different experiences if you're not in healthcare or mental health, there are a lot of different remote ways to work. A lot of us who are in mental health are on Zoom all day long and carrying the weight of really the emotional toll that is COVID. And so we will definitely be speaking to that experience, while also, of course, talking about healthcare workers and the experience of being literally on the front lines. We also noticed that so many of you work in a hospital system, and we know that part of your job and your role is probably to help support the nurses and the doctors and all of those frontline workers as well. So we'll be talking about that. But welcome, and we're just so glad you're here.
So as we go along today, we will be pulling slides up and doing some basic presentation to give you some information, but we'll come back together and we'll open it up for us to have an opportunity to have some dialogue. What we would want to do is, and when we come back together, when you share, please, the first time that you share, would you just give us your name and what your role is, where you're calling in from, that information, and then share what your experience has been. We don't always get a time to just talk with a group of folks. Maybe we talk with those around us, talk with our colleagues, but just talk with a group of folks from different places, around the world, and connect. Again, if we were in person, I would probably have us all look around the room and remind us that we're colleagues. We're not alone, but at the same time we're distanced, and that makes it challenging. So I do encourage you, just look around the screen, look at the different faces, and know that we are all part of a continuum and a group of folks who are providing this care, and this is a group of folks who get it. So if there's any place that we have to be able to express what that is like for us right now, this would be a good, safe place for that. And we want to make that a safe place for us to share. So let me pull a few slides up, and we'll go ahead and get started, kind of kick off our presentation here. Let's go. Okay. I will mention just this first slide, one of the pictures that we chose purposely was this picture where you can see the damage that the mask has caused to this particular healthcare worker's skin from wearing the mask for such long hours, and the toll. I also thought it was interesting. I found some photos of thank yous that kids created, children created for healthcare workers, and I thought it would be appropriate to start our slides with these images. And can we just talk about images just for a moment? And you can maybe indicate in the chat, how many of us are still watching the news? Be my first question. And how many of us have said, I just can't watch it. I'm not going to watch it that much anymore. It's the images. Some of us, it's real life we're living, right? But then there's the images on top of the real life that we're living. And I just want to speak to that for just a second to say that I understand and I get it, that sometimes the images can even become just overwhelming, particularly when you're living it in real life and then you're seeing it pervade on the news. And then of course, sometimes the news will pick up on certain things, and then you're living the reality though. And you're saying, wait, that doesn't completely capture the full reality of what we're talking about here. So images are certainly important. They're important ways for us to make sure that we all know what people are experiencing, but also recognizing that sometimes it doesn't necessarily fully capture the reality of what people are living in their lives.
And it's interesting, Andy, I was watching an interview and someone said, what if we were talking about 747s going, crashing, multiple 747s crashing each day? Would our response be different than it is, with the general public and thinking about the numbers, the sheer magnitude of the numbers?
Right. Actually, the other day, I found myself even just a little frustrated with, I can't remember what it was. It might have even been on a Facebook post that someone had put a post and was comparing like the entire population to how many people have been infected and how many people have died, and almost playing it down. And it was very, it was very frustrating. And I'm certainly not trying to be political about it at all. It was just frustrating to see something being played down that is having such a huge impact on our current state when it comes to healthcare and the ability to provide healthcare even to people, and the limited resources that we find ourselves with, and how frustrating that is to me, that that sometimes things would be played down somewhat. But let's talk about what is the current state. And this is, interestingly, this will change again. I know that over the last couple of months, we've seen every few days there's a new record. Yesterday, a new record was set for a single day death rate of over 3,600 deaths. Total cases in the United States are over 17 million. The total deaths in the United States to date are over 300,000. I think the last number I saw was 308,000. We'll certainly get an update to that today. Total cases worldwide are 74 million, and total deaths reported worldwide are over 1.6 million. And so this is our current state. This is what we're experiencing and what we're seeing right now in real time. And so it's why I even talked about moving into the new year and the knowledge that we're going to be dealing with this when we move into the new year as well. And how we find that endurance to be able to continue to provide the care that we know that we need to provide to people.
Yeah, and Andy, I would say the care for the people under our care, and then the care for ourselves and our families, right?
Yeah. So what's the impact on healthcare professionals? There's actually a good bit that's written about it, but we wanted to pull in this mental health survey that was done by Mental Health America. It was a survey that was sponsored by Johnson & Johnson Foundation. The data was collected between June and September 2020. And I know that in our day and time, September seems a long time ago, and indeed it is. And we know that I would be interested if another survey was conducted now, that we could see just even the impact and how things have changed. But this is back September 2020, and it was a little over 1,000 healthcare workers who participated in the survey. So these are the survey results. The first thing was they reported stress and anxiety, significant stress and anxiety. 93% of the healthcare workers were experiencing stress, and 86% reported experiencing anxiety. Another result was exhaustion. So not only stress and anxiety, but the term was exhaustion. 82% reported emotional exhaustion, with 68% reporting physical exhaustion. 70% reported difficulty sleeping. 63% reported work-related dread, just dreading going to work or having to work the shifts. 52% reported compassion fatigue. And I think that's certainly significant to discuss. And then the other survey results were worries and concerns. 76% were of workers with children reported that they were worried about exposing their children to COVID-19. Nearly half were worried about exposing their spouse or partner. And 47% were worried that they would expose their older adult family members. And to me, these findings are directly related to that first, that this worry, in addition to the dread of just having to go and what they're going to face while they're working, that speaks to the stress and anxiety. But if you notice, that was the vast majority who took the survey said they have stress. So you look at these smaller numbers that are still significant and points to the stress that people are experiencing right now. So what I would like to do, actually, I think I would like to stop our share, and I would like to take a moment just to digest some of those statistics, because it's easy to rattle off statistics and not take the time to consider that we're talking about people and people's lives, and it's not just numbers on a screen. And I know that many of those people may represent us right here on this call right now. And so I wanted to give a moment and just first I'll just say, does anyone have any just initial reactions to that, or even just affirmation in your own life of what you're reading there, or things that you might be seeing that maybe you're missing from that description of what our current state looks like when it comes to the healthcare. You can certainly, if you have a comment or you even have a question, feel free to drop that in the chat, or you can say, I have a comment, I have a question, or feel free to unmute and share.
Andy, this is Carrie Filios,
Go ahead, Carrie.
Colorado, and I'm the bereavement manager at Agape Hospice and Palliative Care, also the director for Starfish Children's Grief Program. And to me, those numbers, they're heartbreaking. And it's the validation that this is really happening. And this is what we're seeing with those that we're caring for, especially one of my primary roles is caring for staff and what I see for them, and then how I see the response of the healthcare system and throwing them back in and just doing the same thing day in and day out without any support, just basically minimizing their experience to it's non-existent. So hearing that, I mean, it's validating that what we see is real, but it's also extremely heartbreaking.
Yeah.
And Carrie, can you talk a little bit more about when you say minimizing their experience? Talk a little bit more about that.
That feeling, healthcare, for those of you who work in it for any length of time, this is your job, and you go out and you do it regardless of what's happening So we see it when, a facility that maybe has those long-term care patients and one of their patients' residents dies. The expectation is you get the room cleaned up, you fill it with another bed or another person, and you move on, and we don't discuss it. We just keep going on. And thankfully early on, our team, they had a separate COVID team that were caring for hospice for patients that we had to isolate from everybody else. And we did a weekly debrief with them, which was helpful. But the things that they were telling us that they saw in facilities or some of the hospitals where they were basically describing war zones and how, they didn't have PPE. The staff in those buildings weren't concerned that their staff didn't have any PPE, stuff like that. I mean, it's just been shocking to me, the lack of response to these folks that are putting their lives on the line every day to go and care for people, and how leadership in whatever capacity just has this expectation, well, your healthcare, that's what you do, and that they're not human beings.
And hearing it likened to a war zone, when you think about when the pandemic first broke out, everybody in healthcare just rushed in, and they're continuing to rush in, but how long can that stamina last, right? And how long can you keep on rushing in without it just taking this enormous toll on not only the healthcare workers but their families?
And I'm concerned about the aftermath. I mean, Andy, you talk about, well, yeah, things will improve and as they get better, and we look forward to that. But they've had to hold it in for so long. And we're concerned about what that after effect is going to be. 9/11, we were all worried about that, and not to diminish or anything about 9/11, but it was a finite time period. Yeah. These healthcare workers are going in and day out, usually 12, 14-hour shifts, and it's months on end, and there's no end in sight for them. So yeah, concerned about how that's going to be for them, and is there going to be any support for them when it does happen, or is it just going to be like we've done in the past, is just, okay, we're through that now, okay, let's just keep going.
Right.
No support.
Right, support for their health down the road, and the toll in a lot of ways. Yeah. Thank you for sharing, Carrie. Does anyone else have anything? Jump in on what Carrie was sharing, or provide your thoughts. I see the comment there, Matt Morse, about healthcare workers. I didn't know if you had anything you'd like to share.
Well, I'll share something. I work in a hospice, home hospice. So people by nature are geared already to deal with death, and certainly that's overwhelming. Immeasurably overwhelming, and we don't know the long-term effects, but people are adapting pretty well. I think, actually, I think the way people get hurt the most, the workers, the healthcare workers, is they're being asked to do things that they don't normally do, like becoming a courier to deliver this or that, and so changing people's roles in a disrespectful way is deeply wounding for these healthcare workers. Another way that I've seen nurses hurt is that they're not, they keep it all secret. If a particular nurse has the virus, they're not validated, they're not seen, it's not known, and that's hurt a number of nurses I know personally.
Yeah.
But yeah.
Thank you for sharing that.
Sure.
And that's a really another good point about being seen and heard and feeling validated as this goes on. Are we doing enough of that to support our healthcare workers? Is there enough support for them out there? And I know so much of it falls on our shoulders as working in healthcare and mental health professionals. But Matt, that's a good point about being seen, being heard.
Well, they actually squelch it in some places so that there isn't a certain kind of hysteria or something. I don't want to use that word, but it's a deliberate practice that the administration does, and it's not right. Yeah.
Yeah.
You
It was
mean they're wanting to minimize reactions from nurses
Yes.
and staff?
Yes.
Yeah.
I think that's the reason.
Has anyone else, can anyone else speak to what Matt's talking about? Would like to share about that?
Or what Carrie was sharing about.
Oh yeah, what Carrie or anything else related?
Saying, yeah, that we've put out there so far.
Well, I would like to say it's Maria Dragopoulos, Director of Bereavement Services at Calvary Hospital. And I also have a private practice. And I guess I've been feeling like, managing all the different roles has been a lot. And also, really caring about my staff and trying to figure out ways to do both. I mean, it's hard to balance like the needs of the hospital and the needs of your staff and your own needs. And I guess I was really connecting to what I saw in the slides and what I heard people share in Carrie too, about, just, I think I'm really good in crisis mode, and I've been feeling it coming now, in this stretch, just feeling emotionally exhausted and not having as much to give now. I always that's kind of my process, like holding it together through the, the peaks, and then kind of now I'm starting to feel it now, and I know my staff is. And it's also like, to speak to Carrie's point a little bit, we were tasked with doing things differently too. We generally deal with, we're an outpatient program after the death, generally. And when you work in a hospital, it doesn't matter what your role is. Wherever you're needed when a crisis happens. So we were tasked with helping inpatient and trying to figure out ways to help the inpatient staff with their emotional needs, which that requires a lot of strategizing and thinking, because they're not the easiest group, of course, because they have to keep it going too. You can't just leave patient care to have your feelings. You can't do that. You have to show up and you have to take care of patients. So I think there's so many complexities. And I know our department has really had to stretch themselves in so many different ways. And we've all kind of worked together to try to find out, how can we take care of ourselves? I mean, we've increased our huddle times so that we meet together, twice a week, because we're all in different departments. But I think like this is something we've never experienced before. And I don't think any of it kind of has felt like enough. So I just wanted to acknowledge that and say, especially when you work for a nonprofit, there's not a ton of support that can be available. That's the nature of nonprofits in many places. So I think it's a very complex situation. And I thank you for creating this platform for us.
Thank you, Maria, and thank you for pointing out, and a couple of you have pointed out that you're asked to step into a different role. Your role is aftercare and bereavement typically, right?
Mm-hmm.
But now in the middle of this pandemic, you're asked to step into helping the rest of the hospital staff with all they need and help with maybe patient care in a different way than you normally do, and interacting with families in such a different way. And we haven't talked about that yet, and we can talk about that as we go along. But even the difference in families not being able to enter into the hospitals, and the role that all of you are playing with being the connectors between being inside the hospital and the patient, and the families being outside of the hospital, not being with their family members. How difficult that is.
Anyone else want to speak to this from your perspective? What you've seen, what you've experienced?
And then as Andy said, as we go along, you're welcome to put it in the chat. You're welcome to unmute and speak, or you can even put in the chat that you have something to say and unmute at that point. Really, whatever you feel most comfortable doing.
So a lot of times the next question that comes to my mind, if this is the current state and this is what we're seeing, and the one thing that surveys don't do is they don't give us the detail that you all just shared, right? Like what's behind those stats. And so it does, in my mind, certainly we've talked about a number of the things that cause the stressors. And the other thing that surveys don't do is they don't predict the future either, right? Nor do surveys make any of us experts on what another person's experience is. And so we do know, and we recognize how personal and individual all of this is to very specific individual lives, but also then the toll that it has on us as a whole and as a community. So yeah, please feel free to share and jump in. I'm going to go back to the slides and let's talk for just a minute about stress though, because let's just talk about, again, we can't predict for sure, but it would be helpful for us to think through. And just a reminder, I'm going to put up what we all know, the impact that stress has on our health, right? So let's talk about that just a little bit, what that looks like, and maybe come back together and think through a little bit. What are some of the strategies that we want to think through and put in place so that we can be prepared down the road to address whatever issues that might arise as a result of what people have been living through and what that looks like. So let me go back to our slides here. Share my screen first. Well, usually a little quicker than this. Slow on the draw today. Go here.
I think we've all had a lot of long days, Andy.
For sure.
I think everyone on this call can probably relate.
So I think part of it is even just to talk about the science of stress. What is stress and what do we know happens? Even just that, again, that fight or flight response. We know, and many of us, just as a review, we all know that when we are stressed, when we're in that situation where our body's natural response would be to produce cortisol, which increases our sugar levels in our blood. We know that when we're in that type of state, our digestive system shuts down, reproductive systems shut down, systems that aren't needed in a fight or flight situation. And we're hyper focused on certain parts of our system. And we also know that there's different levels of stress, right? So there's what some people call positive stress or just kind of normal stress that we all experience. And typically it's situations where we might be stressed in a given moment, but the stress is very immediately relieved. There's also tolerable stress, which might last a little longer than, say, what we might call positive stress. Maybe we have a deadline at work or we have a stressful day at work, but we find relief when we are finally through that day or we meet that deadline or whatever it is, and the stress then reduces. But then there's this thing, toxic stress, and that is when our stress level is just heightened over long periods of time, and we don't come down from that sense of fight or flight, that sense that there's danger around, and our system continues to produce that cortisol that we know over long periods of time ultimately causes damage to our bodies, to our physical bodies, to our minds, to our health. And we know that that there's a variety of results that, or consequences, I guess maybe it's a better word, to not being able to alleviate that stress over a long period of time. Now, we know that a lot of us are familiar with the ACEs study that was done on childhood trauma and what we learned about stress in children and how, again, stress over a long period of time impacts their healthy development. But we know it's also true for us as adults that though we may be fully grown, our systems are grown, our brains have developed, we can still be, our health can be impacted by that acute stress. And so when I see stats like what I'm seeing, and out of 1,000 something healthcare workers, almost everyone saying they're experiencing stress, is the question in my mind is how if they are they finding a way to, are they finding moments when they can reduce that stress level? And so I think about a number of things with that, because the other statistics that are on there is it's not just what they're doing at work that's stressful to them. There were also findings around stress that they're not able to be the parent they want to be to their kids right now. There's stress about bringing COVID home. So it's not like the shift ends and then the stress ends, because the stress is related to a number of issues that are related to different parts of a person's life, not just their work life. And so that becomes the concern. And we know, those of us who've worked with families in counseling or other settings, we know that many people come to us for therapy because of a heightened stress in their life, and a stress that won't, abate, right? That it just continues over a long period of time. And so what does that mean to us, I guess, is as folks who would ultimately be supporting many people who right now are experiencing this. And then we also know that anxiety, when it's experienced above normal levels and duration, it also, not only does it affect the body, but it lowers the immune system. So I've thought about this and wondered about, just even in healthcare and healthcare workers, there are stats, and they're changing every day, on how many healthcare workers have contracted COVID and how many have actually died from COVID, given their lives in this frontline battle against this illness. Interestingly enough, if our levels are heightened, and our immune system then is lowered. And then also just thinking about the effects that chronic stress has on the body: anxiety, depression, digestive problems, headaches, heart disease, sleep problems, weight gain, memory and concentration impairment. And if you look up the study, and we have information in the slides where you can go and actually look at the survey yourself, and it addresses a number of these, that they're seeing a number of these in healthcare workers as well. I put this picture of bamboo patch for a reason. It's actually the illustration I like to use when I talk about stress. When I was a kid, I grew up in North Florida, a little town called Apalachicola. It's a little fishing town on the Gulf of Mexico. And in my backyard, we had a bamboo patch. And so my friends and I, we would go out there, and we loved to, when you're a kid, you like to build like forts and huts and things like that. So we would build our forts and huts, but we would use the bamboo because it made a really good structure for us. And then we would interweave like palmetto bushes in, and they were these cool little shacks kind of that we would build out in the woods. But what I learned about bamboo is if you went out to a bamboo patch and you tried to break a piece of bamboo, it's not going to happen. I mean, I think even the strongest person in the world probably could not snap a piece of bamboo, because it's the consistency of it is almost like, it's like fibrous, you know, and it's all connected in with one another. And if you try to bend it, you can actually take a piece and you can bend it and touch your hands together, and it still holds. You actually have to take a machete or some sort of a saw or a knife or something, and you have to chop it, and you have to go right through it. Otherwise, when you bend it, it would just, matter of fact, even if you tied it off, if you bent it and tied it off, it would actually stay. Once you untied it after a few days, it would almost stay in that shape and never really bend back to where it was. And the reason I like to use that as the illustration is, to me, that's an illustration of stress on our bodies, is that yes, many of us are resilient and we're able to take a lot. And I think, Matt, you'd even made the remark of how adaptable healthcare workers are, and they are. And I always find it, to me, it's inspiring just how much humans can endure, really, and endure for some period of time. But my question becomes, how long can we hold that bamboo in that place? And you think about the stress point is that top point. If I'm holding it here, the stress point is here. And if you hold it long enough, though, even though the bamboo's strong and has integrity, what will happen in time is you'll see fibers pop up like this. It breaks that way. It doesn't snap. It doesn't just snap. It's a little at a time. And my question always becomes, what are those fibers, right? What is it? What's the medical issue? What's the mental health issue that's a result of living with chronic stress? And then that becomes impact. And once we, say we're in a different place and we're on the other side of all of this, will there be the coverage? Will there be the attention to the consequences that we'll see down the road of holding that stress for that period of time, and how that affects us? And so, of course, one thing that comes to mind is compassion fatigue. And you saw that survey was from back in September. And there were almost half of those surveyed said they were experiencing compassion fatigue. So what happens then down the road? I see Carrie's mentioned, this is one of my biggest concerns, will there be support for the aftermath of all the stress we're enduring? And that's exactly, thank you for saying it like that. That's a great way to put it, is we can have this conversation today with one another, but if part of it isn't putting a little reminder in our minds that we commit, those of us on this call today, we commit that we won't forget, right? And that we want to be part of that support in the aftermath, I think certainly becomes important. But compassion fatigue, now this is something that a lot of us may be familiar with in our field, just ourselves. Some of us may have been there and back, The book by Charles Figley, Compassion Fatigue, is what addressed this particular issue. And of course, it can cause emotional and physical exhaustion. What did we see in those stats that we just put up on the screen? Was a large majority of healthcare workers saying they are experiencing both emotional and physical exhaustion. It may lead to feelings of irritability or overwhelmed or just being anxious, and certainly burnout can become a part of that. And just a little information just on burnout. Go ahead, Pamela. Yeah.
One of the things that I find interesting is mental health professionals, I think we're very familiar with the term compassion fatigue. One of my friends is pretty new to nursing, and she hadn't heard the term yet. So I don't know that it's always talked about necessarily in nursing school, but of course, nurses will, and healthcare workers in general, will experience this pretty quickly in their career, not burnout, but compassion fatigue and just the toll of caring for others. And we'll certainly be talking about self-care and the need to replenish ourselves as we go. But I hope that it's being talked about more and more in nursing programs, and the need for learning how to care for yourself really right from the beginning to help stave off burnout. But I think about, and I would love for anybody on the call to speak to this, I think about how do we prevent burnout in an environment like we're in right now? Is it possible? What are some of the things that we can do? I guess I'm talking about protective factors, and are they out there? Somebody said it was not addressed in your MSW program.
Yeah.
Carol said, yeah.
And we're gonna talk about grief and bereavement in a moment, and that's not covered in many of our programs either. That wasn't part of many of our studies. Yeah, wasn't mine. I mean, I didn't have courses on it. That's for sure.
Right, that's so true. Even now, yeah. We would love your input around compassion fatigue or stress, certainly toxic stress. That's something else that I don't think we learn enough about, toxic stress in our programs and the effect that it can have on us.
Yeah, there's the comment here that nurses and NPs were not familiar with the term compassion fatigue until they came to hospice.
Mm-hmm.
That does make sense that at hospice it would be more a more used term. Yeah. Utilized.
I think sometimes there's power in just knowing that terms like that exist and that others experience it, right, in the profession.
One of the things I thought about when I was thinking about, how do we take time to stop and care for ourselves? Quite often, though, if you think about it, if you're on a ship and the ship is sinking, you're not thinking about self-care. You're thinking about, what do we have to do to keep this ship from sinking, right? Or what do we do to survive through this? And I just wonder, even as everyone's in the midst of it, and is there even, is self-care something that happens on the backside of it, or are there ways in the midst of, even while you're on the front lines, to be able to have those moments to care for yourself? And I don't know, if anyone's observed that in the staff that you work with or that you interact with in healthcare, and what that might look like for folks as well.
So I'm willing to speak to it from a personal point of view. I got a really harsh example of it even before COVID. And not this past summer, but the summer before, I was struggling with some health issues personally. And then my mother in Rochester, New York, so I'm in Tucson, she's in Rochester, 90 years old, gets majorly scammed. So I had to go rushing to Rochester to try to do something about that situation. And then I came back and I kept getting sicker and sicker. And I'm a very, type A personality, always doing. And I ended up with a heart condition, AFib, that ultimately I ended up having to have surgery for. But I think part of that was because I had stopped doing anything self-care wise, pretty much. I mean, I still exercised on a regular basis, ate pretty well, but nothing else that was very supportive of myself, and didn't take much vacation, didn't, do the types of things that I've been doing since then, because it was such a wake-up call in that sense. And so that's just personally, but then, so I in Tucson, I work for Casa de la Luz, which is a hospice here in Tucson. And one of the interesting things to me was when I first started working there, I'd been trained in mind-body skills through the Center for Mind-Body Medicine several years ago. And so when I started working there, I said, hey, wouldn't it be great to offer this to our bereaved people? Mm-hmm. And I got this like, sort of response. You know, oh no, we don't do that kind of stuff. And I was like, okay. And so I waited a couple of years and then I suggested it again and said, well, I could do a workshop. And they were like, okay, you can do a workshop. And so I did that. And maybe another year or two later, they were open to my doing a group, the full-on group. So I now do basic mind-body skills groups for my bereaved folks, which is great. But I still can't get the staff to do it. It's like, I keep saying I'd love to offer it to the staff because I think they could use these techniques, but they're, you know, I'm too busy. I don't have time for that. This is always, you know, no matter what kind of space you offer for it, everybody is always, I don't have the time for that. And I keep thinking, if you, especially after this past year, if you don't take the time for it, it's sort of like what you're talking about, Andy, it ends up really just doing a number. It does a number on your body, on your soul, on everything. So, yeah.
Thank you for sharing that, Carol, and thank you for sharing your personal experience with all of us. I think the challenge is having people hear it and really own that. When you're in the midst of what we're in the midst of right now, it is overwhelming, and it is a common reaction to say, I don't have time for that right now. We're in the middle of something big, and I just have to be on, and we do. But how long can we do that and endure that before it has the effects? All of us, many of us who worked, I know in my time at hospice where I worked here in South Florida, it was evident that particularly when someone had a long-term caregiver that was caring for someone who had a long-term illness that ultimately became a terminal illness and that person ultimately died. How many of us know people who were in that situation, and then as soon as their person dies, they all of a sudden have all of these health conditions themselves, and it's that toll that's happening, in their life. Stephanie, I noticed you had unmuted. Did you have a comment that you wanted to share?
Hi, I'm Stephanie. I work for Calvary Hospital. I'm a bereavement counselor. I work under Maria, who had shared earlier. But I wanted to share the concept of delayed grief, and it's something that has been floating around my head recently, both being here and also working in this field during this year. I lost my mother in January, my dog in May, and recently my aunt last week. And being in this field through all of that has kind of oscillated between my own grief being put on the back burner because I'm prioritizing my clients and my job, but also realizing that it has delayed my grief, and thinking how it's made me feel makes me mindful of the fact that some of my clients who have lost their loved ones this year may also have some delayed grief. So circling it back to the idea of how are we going to provide support in the aftermath when there is all of this delayed grief finally having the chance to come out, what is that going to look like? Because I think that's something that we're anticipating, but we're not yet prepared for. And so it's just an interesting discussion I thought I would bring. I'm not sure if any of you are grieving loved ones. If you are, I'm so sorry, but I know it's a reality right now. And I think juggling all of that makes self-care so hard because, like a few of my coworkers have said, we're in such a survival mode right now. And so a lot of our self-care routines either aren't able to be carried out because of the way the world is shut down. And also we're exhausted. So we're prioritizing rest, which is self-care at the same time. But I just wanted to put that out there, and I guess validate anyone who is feeling the same way, and also just talk about delayed grief and what that future support may look like, both personally and in our professional lives.
Well, thank you, Stephanie. That is really such a good point. I haven't heard too many people really speaking to delayed grief and the aftermath when so many people really come out of this year. And Annie mentioned, looking at 2021 and where we'll be. But I think that that's when a lot of this will start to show up. We'll be in a new year and people will be wanting to feel better. And also some of the, being on the sinking ship will be changing, and we'll no longer be on the sinking ship and everyone will be on shore, but everyone who has suffered a death or been in the middle of the sinking ship will be grieving and looking for support. And here we all are who've been supporting everyone this whole year. They'll be turning to us, right? As we continue. Last week, one of our friends, not a very close friend, but a pretty good friend, died of COVID. He contracted it and 2 days later died. And of course, there's been no funeral. And, my husband was closer to him than I am or was. And, I've had a lot of work demands. So I'm exactly what you just said, Stephanie, straddling the work demands and my obligations and supporting him and our other friends who knew him. And I think most of us on this call probably do have a similar story, because COVID is affecting more and more and more of us in terms of not just knowing people with COVID, but knowing people that have died of COVID. The grief field lost Howard Winokur just a few days ago. Probably quite a few on the call know him as well. He died of COVID very suddenly. And, the ripple effect and the repercussions are immense. I'm wondering who else would like to speak to delayed grief and what Stephanie was talking about.
Yes, I would like to speak to that. So I'm Sherry Schachter, and also from Calvary Hospital. When Stephanie was talking about delayed grief, I think what you almost touched on, Pamela, and that is, come the new year, all of these families that have not been able to have funerals, memorial services, wakes, shivers, the rituals that they're accustomed to and yearn for, is going to reoccur as they plan memorial services and eulogies and ways to remember their loved ones once this is over. So I think that we're going to be seeing delayed grief on many different levels, not only this coming year, but I think throughout the year. I think there's going to be enough research here for decades of the effects on bereavement from COVID.
I would agree with you, and I would agree with you, Sherry, and thank you for adding that in. We kept hearing about a second wave or a third wave of COVID, and I think what we're all talking about is this second and third wave of grief, and really deep emotional grief and pain that will be coming our way.
Stephanie, I just really wanted to applaud you for being so open after having so many losses. My heart just breaks for you. And it speaks to something else that I don't know if it's in anyone else's mind, but your story kind of, my aunt thankfully has recovered, but COVID and in a nursing home, haven't been able to see her. When we're working with our clients, we're in a parallel process. So all the things they're talking to us about, we're in the midst of that ourselves. And I'm just wondering how everybody else is coping with that. Because I know for me, we have talked about how we compartmentalize and yeah, we just do the work. But now, however many months in we're in, I'm finding it's harder and harder to do that because I'm just so exhausted myself of trying to keep, their stuff and my stuff separate when our stuff is getting more and more pervasive. So I'm just curious how others are coping with that, or.
It's a great question, Carrie. Would anyone like to speak to that? I can say in my own life, you know, I've been very, very busy during all of this, and I stay busy. I run a number of support groups that are evening time and virtual, and that keeps me busy. And I have projects I'm working on and all of these things. But I can tell you when I have a free moment and I even begin to relax, you know what happens? I get a migraine headache. That's when the headache comes, is when I decide I'm going to relax for a few moments. So I hear you on that, Carrie. And then in addition to it, and this is another thing that I think is important to me, the stress on our healthcare system. There's all of these other, let's talk about people who are dealing with issues outside of COVID and the ability to get treatment and treated because of the stress on the healthcare system. I have one of my best friends in the world is having some pretty serious issues right now in his life. And it is drawn out because he can't get appointments. You know, it's months before he can get appointments. He, you know, even when he sees healthcare and gets the support, it's a struggle. And so, you know, to me, I mean, we're talking about those affected by COVID and those types of things, but just even people who are grieving the death of someone by anything, right? And not able to have those rituals and that, you know, those things, but also people needing other types of treatment and what effect that will have. I don't know how we collect those statistics, but you see how many people have died as a result of COVID. How many people die from other things as a result of COVID, as a result of the situation that we all find ourselves in. So, I mean, that's just a little on me. That's been my experience. It's heightened, certainly the stress level for everything.
And Andy, that's a layer, isn't it, of people needing treatment for other things and not being able to be treated, right? That's just another layer. Hospitals not being available. I know they opened up for a little while for non-emergency surgeries and whatnot, but now it seems like they've closed back down because of the need to keep the beds open. But that does place additional stress on families and people who need those services. Andy, you also touched on people that have had somebody die that wasn't COVID related. And I know that I've heard, I also, like Andy, I run support groups as well. And Andy and I, in addition to working with Willow House, we work for a lot of other organizations. And I'm running support groups right now virtually with Compassionate Friends. And one of the recurring themes that I'm hearing is that if your person didn't die by COVID, people are feeling a bit disenfranchised, although they're not using that word, I'm using the word, but they're feeling that their grief doesn't matter in the same way because it wasn't or isn't COVID related. I'm wondering if any of you have had that same experience with the families you're working with.
Samantha, I think you were going to say something. I think you had unmuted and we're going to share. If you want to jump in, we invite you to.
Sure. So I'm Samantha. I'm also a bereavement counselor at Calvary Hospital. And I wanted to touch on what Carrie was saying about, the parallel universe that we're in right now, providing support to people who are bereaved, specifically due to COVID. I'm currently facilitating a death of a spouse partner due to COVID group. And I have 14 individuals in there who lost their spouse due to COVID. Mm-hmm. And not only is, our field challenging, but this is such a new type of loss, so sudden, so many different age ranges, and just having that group and then leaving group and also facing the world of COVID as a person, not even as a counselor, it's challenging navigating that. I found myself feeling at times very triggered by the world just due to, taking to heart stories that my members share. And each day I feel like my schedule and my self-care looks different because every day I need something different, and I'm just trying to get through day by day. So that's what I've been doing, not setting expectations for myself, because I know they're unrealistic right now. And I'm very type A with like needing to be scheduled and getting things together and having a list. And I'm finding right now that that's not working at times. And I need to accept that and kind of just go with what I can handle for the moment.
Thank you for sharing that, Samantha. I know others can probably relate. I saw a lot of heads nodding up and down as you shared. And interestingly to me, you said you're type A. Shocking that some of us in the caring profession are type A people, right? And my sister-in-law is a nurse. She's type A, and I joke with her all the time. I'm like, you're a nurse and you're type A. This is really shocking to me, right? But that's an important piece, though, is knowing even our own personality and our temperament and how that impacts even the situation and how we interact. Anyone else want to speak to that?
Hi, my name is April Harvin. I work at Calvary Hospital as a bereavement counselor, and I also am doing groups outside. And what I'm finding with the people I'm working with is just that's for me also a parallel process, is that there are a lot of COVID related deaths, but not necessarily because of the virus. In the communities I work in, the lack of access to healthcare, as you were saying, before COVID is exacerbated, and people are losing people because of that. And some of the communities, lack of resources, like people losing jobs, not having fear of housing, and those things have increased aspects of community violence, and people have lost people because of that. And in those same families are losing family members to COVID because of the disproportionate impact it has had on communities of color. And for myself, as an African American woman, I'm impacted by that, both in doing the bereavement work, but also personally. I fortunately have not lost family members, but in my circle, I have a friend who lost her mother. I have people from my church who have lost family members, and being pulled to, like, how do I deal with my own almost vicarious grief? I don't mean that way, but my vicarious trauma of watching them go through their grief, be present as I'm doing this work, and I'm just starting to do this work at Calvary, and also hold my own in a world that feels quite threatening. And so, sometimes it is just kind of, when I'm not on, trying to turn totally off, but then that's kind of hard to do, because there are things I like to do to prepare to work with people, to serve people, and I can be in front of the person, or be in front of the Zoom, but once that Zoom camera is off, I'm like, okay, I'm done. And that's hard, because I want to give them as much as I can, because they need that support. I want to keep reading. Reading is one of the things I've actually lost in this life. I just want stuff thrown at me, like TV, just throw it at me. I don't have to think.
Right. Things I don't have to digest, right? It's just easy. Brain candy, we call it, or whatever.
Yeah, it takes brain to read, doesn't it?
Yes. And I love reading, and I want to read more. I want to, it's like, is there a video for that? And then it's a video in front of a computer. No, maybe not. Just TV. Just talk to me. A talking head, throw it at me. And I'm looking to try and find other ways of self-care other than sleep or TV.
Thank you for sharing that, April.
I wanted to point
Andy and I did, we did an all-day Zoom yesterday, and at the end of the day, I said to Andy, I'm about to go have dinner and do anything that doesn't involve Zoom or a computer. And left my cell phone in my office, and that was that. Lauren, about to say something.
Yeah. April, thank you so much for sharing that. And some of your points makes me reflect back on looking at the chat from James a little bit higher up. He's talking about the idea of detachment and also then the height of turnover in the healthcare system. And I just think that's such an important piece to talk about, because if we are not giving ourselves this self-care, and if we are not letting ourselves just listen to, you know, the talking heads on screen and taking our breaks, that is such a concern. And I get questions from people not in mental health or healthcare saying like, why is this staff always moving? Why is it always, like, administration will ask this question sometimes. But it's, yeah, James said the sustainability is.
I'm wondering if we could talk about that just a moment, Lauren. That's a good point that was brought up in chat about turnover and what does turnover look like right now this year, and what might it look like in the future? Anybody want to speak to that from their point of view, from what they've seen, or from their work, people they know? And I guess another question, part two question, would be, how is that related to burnout and compassion fatigue? You know, one of the surveys that Andy and I were looking at is where one of the questions in one of the surveys we were reading is the question was posed, did I make the right career choice? Another question was, should I change careers? And how might COVID and 2020 change people's choices around their career?
Yep.
I can touch on that, Pamela. So I started at Calvary, and my colleagues are laughing, but it's okay. So I started at Calvary in March, and a week in, you know, was so eager, finished my master's, first job, and then COVID hit, and it was like a tsunami of chaos. So I've definitely had that thought, you know, did I think that my first job would be in a pandemic? Absolutely not. So just navigating that, and, you know, the work is hard that we do, and no amount of schooling can teach you how to navigate bereavement through a pandemic, right? So if it wasn't for my team with their support and, you know, what I've gained from my academia, but also pulling from everyone else's knowledge, I don't think I would still be in this field. But I love the work, and seeing just the outcome of COVID and how many people are dying, this work is so needed. And you learn to really connect with your clients and be a part of their journey, and it's so beautiful. But it was rough starting during this time. So.
And so you literally started in March of 2020?
Yes, ma'am.
This year.
Mm-hmm.
Wow.
Yeah.
Mhm.
The story to tell for years to come.
Yeah.
You know, I'm reminded that after 9/11, I was not at Calvary at the time. I was in another hospital, and we had a wonderful palliative care physician who came in one day. This was shortly after 9/11, came in one day and announced he was leaving, he was resigning from the hospital to open up a restaurant. And we were like, but he had gotten, it was incredible, you know, all the years of training and such a fine palliative care physician. He had just decided this was too much. It was too much. So yeah, I think a lot of times.
Right after 9/11.
Yeah, that was after 9/11. Yeah.
And do you know anything about him now, Sherry? Is he still in the restaurant business? I mean, I don't know about.
I don't know. I lost contact, so I don't know. But I hope that he, found some peace and was able to do both, because he loved medicine and really was an excellent physician.
I
So
wonder if he ever made his way back to.
yeah, yeah.
And thank you for sharing that, Sherry. And something else that Samantha just spoke to is the team there at Calvary, and having a strong support team, at your job, how incredibly important that is. And if you're fortunate enough to have that strong support team at work, I think that really we can't speak enough about the value of that. Being able to, and not only, maybe it's not just at your organization, just having colleagues in the field, right? How many of us lean on colleagues throughout the field? I know that I certainly do. And how important that is now more than ever, whether it's connecting via Zoom or however on the phone, or however you're able to connect. I think that's a huge part of self-care as well.
Absolutely. I was thinking about going back to Samantha, also just starting a job in March when all this started. And I remember hearing that they were recruiting like the newly graduated nursing classes because they really needed those nurses. And I thought, boy, they've got nothing under them except, for their nursing training, but just kind of thrown into this world of COVID as newly graduated nurses. And I just thought, and then nurses being, redeployed into different areas of the hospital that they hadn't signed up for, or their, training wasn't in that specific area, but just doing what they had to do, and just how difficult that is for all of them, I'm sure.
Yeah. Being a brand new nurse going into, or a brand new physician,
I can't imagine
going into a hospital setting right now.
Hi, my name is Jacqueline Marlowe. I am one of the colleagues from Calvary Hospital also. I am an art therapist from the UK and arrived here last year, approached Calvary as a volunteer, and some weeks later became hired in COVID, like my colleague Samantha. Want to speak a little bit about the strength of team and that I am a part of. It is a group of I think approximately 9 women and 1 male, but they are unbelievable in terms of their knowledge and bringing it together. That we were, as I entered as a volunteer, and as the days became weeks and then months, what we rallied together as a team through these online platforms and under the leadership of Cherie and Maria is just an unbelievable experience, right? I came from having my own art studio, having clients come in one by one, or a prison setting. This is very different, working bereavement services and grief services on the front line. But cannot underestimate what you learn in the meantime and how you strengthen during that time because of the people around us and the resources that you use in terms of leaning on them, in terms of them leaning on you, and those moments of spillage for your own internal self and your own experiences, how you can, with a trusted team, still hold despite of those challenges that are going on outside of us. And so just wanted to thank the team, but also this platform here of having this conversation with one another, and that vivid images of those fibers sticking out is really powerful, and how they do, and how we gather around that and talk about that there's no shame in saying that something's not quite right here, or I'm experiencing this through family members in England, or a colleague going through something, that we have the ability in our team to be able to, and are welcome to, talk about those moments where that fiber appears and starts to unravel, and we can catch that together as a team and hold that fabric together and continue to do this amazing work.
Thank you, Jack. That is a wonderful image too. Thank you for saying that. I mean, it really is. It's that we're not in this alone. And I will say, we've done a number of calls now for the last 2 months, and every time I just leave heartened, because I know that we do have each other's back, right? We can shore each other up, and like you said, if one of us, that fiber, pops out there, there's someone there to support. We don't have to carry the load alone. We have each other.
Andy, I'd like to add something.
Yeah.
I'm another Calvary person, and my major defense is humor. And so whenever anyone would ask me how I was doing, usually people not in the team, because we all knew how we were doing, I would just say, there's never been a better time to be a bereavement counselor than during a pandemic and a summer of unabating community violence. And I would say it just like that because it would make them stop talking. But that's the only way I could do it, because I could sort of separate myself out from this incredible, I'm not going to swear, this incredible freaking year that we've all had. And as some of us have said, going through the exact same things with our clients and holding all of this energy in our Zoom screens. And, normally when I was still working at the office, I would finish the group at 7:30. I would clean up the space. I would make a little schedule for the next day. And now, and my colleagues know this, now when the Zoom is over, I, say goodnight and I'll see you next week. And I slam down the cover and just swear.
Right.
Because I'm just holding so much energy, as I know we all are. So this is a second career for me. So I haven't been doing it very long. But, I still think that there's never been a better time to be a bereavement counselor than during the pandemic.
I'm wondering if anyone would like to speak to what Rachel just said, just about everything that really the confluence of. You forgot to mention the political unrest, by the way. Not that we're going into that, we're not. But I mean, just let's add that to the pile, right? Anyone want to speak to that? Being in this line of work at this point in time.
I think also it's come up for us, not only personally on my team, but, professionally. I mean, it's so much also been embedded in the COVID groups. The conversation comes up. Actually, this week, I hadn't even thought about this because I guess I was thinking about other stuff, but like people had such a strong reaction in my COVID death of a parent group for the vaccine coming out. And that was like a huge discussion. And we've had to have conversations in our group about how to navigate, different politics in the group. And that might come up. Like, what if you have, people who support Trump or Biden, or, people who don't believe that white privilege exists, and, like how, because those things can come up in group discussions. And that in itself has been daunting too, because it comes up it's been coming up in a different way recently with all the unrest.
And the mask versus wearing a mask versus not wearing a mask.
Yeah.
And we actually have some slides we'll go over later, but all of the things that were issues before COVID are still issues, right? And so it's that those things are still transpiring, and in many ways, like you said, even exacerbated by the current state of things.
I am curious about something that Maria said. If we could just pause a minute on this, I'm wondering how many of you have added or deepened or expanded upon your ground rules with your groups to accommodate for all of these additional issues. And if you're willing to share the verbiage around that, certainly you don't have to necessarily put it in the chat, but if anybody's willing to share some really great ground rules that others could use, especially in the virtual environment, and how you navigate those complicated conversations. Not only are they complicated if we were sitting around a room together, but boy, are they complicated when you add in the Zoom room, right?
Pamela, I'll just say, when you said this, I see some of my staff laughing too, because I'm happy to share our guidelines that we've expanded on. But one of the things that I think is pretty, might lighten the mood for a second, was we were contemplating like putting in the guidelines, all of these different behaviors that we're noticing in the Zoom during group. And we were laughing because I was like, we can't possibly capture all of these different experiences. Like for instance, one of our counselors, somebody was talking to her during an intake on the toilet, one of the clients. So we were
Really?
laughing and we were saying like, should we put that in the guidelines, you know, that you can't do an intake on the toilet. So I think
it's not a room allowed on Zoom.
I will say one of the groups that I work with, we did put into writing about be conscious of munching on chips, laying in your bed while you're on the Zoom. Like we did put a few things of please be conscious of these things, you know, because they would show up. We had one point a lady who balanced some chips on her chest, on her stomach, and was just kind of laying back and like eating these chips.
Oh my God.
And the view wasn't flattering, nor was the chips flying everywhere out of her mouth. So it is funny, but it indeed, you know, it's kind of like, how do you do that? Like it almost maybe even just creating like a Zoom etiquette document. It's even separate from our ground rules, just to say, hey, just a few things you might want to know, you know, about.
Andy, we have one of those, by the way.
Yes, we do.
Document, but it's not been updated since probably April or May. We could add, you could almost do a Zoom etiquette from the lighter side, if you will. Don't be lounging, you know, in your bed eating chips while on Zoom. I mean, and maybe
that's right.
Maybe that might be internal. I don't know if we could put that out there, but we could probably come up with a lot of scenarios that we've seen. I know one of the support groups that I ran recently, a woman was on Zoom on her phone, and we saw her ear the entire time because she was listening to Zoom. And I mentioned a couple of times, like, you might want to prop your camera up, and, you know, we all kind of figured out delicate ways to get her to go, you know, put it back where we can't see your face, but no, we saw her ear the entire time. But, you know, if you think about it, those can give us an opportunity just to have a little bit of a lighthearted moment that I think is welcome, right? Yeah, but would love to share, anybody who's willing to share ground rules in the Zoom world. One of the presentations that was included in the all-day one we did yesterday was just talking about the virtual world and Zoom groups. And I know for me, I'm always wanting to learn more, just because we're learning from each other, right? We're creating it as we go this year.
Emma, I wonder if we can go back to our slides for a moment. We've talked about, and thank you all for this robust discussion. This is number one, it just feels cathartic to be supported and affirmed by our colleagues. We've talked about sort of the impact on healthcare and healthcare workers. We wanted to talk just for a few minutes and bring the public into it and the impact that this has had on the public. And we've already alluded to it in this conversation, talking about what are the issues going to be down the road that we're dealing with and the consequences of these things. But let me pop our slides back up here, and just wanted to present a little bit on this idea and what has the impact on the public then. So try to get my slides together here.
I can see him on the screen.
Okay. Great.
Yeah, everybody see him. Andy, do you want me to go ahead and go over some of these?
Yeah, go ahead. Yeah.
And we'll broaden it back out to everybody. And I feel like some of these slides, and again, you'll be receiving copies. Some of the things that Andy and I are talking about, so many of you not only know this information, but you've been living it and working in it. But when we create a presentation like this, we want it to be part presentation, part educational, part debriefing. And we're always cognizant that if somebody clicks into this recording and they might be new to the field, we want to have really a presentation that has those initial basic building blocks, if you will. So there will be some basic things in here, but that's why it's in there for any of you who've been doing this a long time. And this is a good example of that, right? The things that we're seeing as a result of COVID-19. I would say one of the things on here that really hasn't abated is the fear. For some people, they've said, I'm not going to live in fear anymore, and forget it, it's all hype. And then somebody they know gets really sick from COVID or dies from COVID. And more people, at least that I've worked with or that I know who felt like they were rejecting COVID overall are coming back around going, oh, wait a minute, now it's really scary. I lived for 30 years in California, and in Southern California specifically, and Southern California right now is just being ravaged by COVID. In fact, it reminds me a lot of how New York and New Jersey back in the early days of COVID, really what all of you there went through. And Illinois and Wisconsin and everything that you guys are going through. I think the public emotionally and mentally swings back and forth, right? And the anger and really rebelling against the idea of COVID kind of swings back and forth. But as more and more of us know someone who has not only contracted COVID, but who has died from COVID, we see a different reaction. And Andy, I'd like actually if you could pull the slide back down, and I'd like to just talk about that for a moment and the difference that we've seen in our families and the difference we've seen in the public with all of the changes. And as they've gotten to know people who have died. Matt mentioned isolation. Yes, the isolation is causing people to react very differently also, isn't it? How long can you be isolated? How long can you be by yourself? How long can you be not in touch with your support networks? How long can you be stuck inside? Think about all the people who don't have access, really good access to outside. If you live in a large city, you might not have a backyard if you live in an apartment. Anybody want to speak to that and just what you've seen with your families?
Pamela, in Colorado, we're seeing a huge spike in COVID.
Mm-hmm.
And what we're seeing a lot of people, just what you're saying is, I'm not going to believe the hype. I'm not. And so we had a just rampant COVID because everybody just kept saying, I'm not going to live like this anymore. And we're primarily an outside state. But we saw it through Halloween, just people went crazy. And it's still doing that. And now we're seeing that, as everybody here on the chat's been talking about, now people in your inner circle have gotten COVID or know someone who has died. And, we're seeing a lot of that here. Unfortunately, it's not changing behavior. There's still, I don't know if that speaks to that point of yours about how long can people stay isolated? How long can they be in the fear? And, here's the backlash that's coming, and it's actually having a very bad toll on others.
Mm-hmm. And I think the impact on people who are grieving because somebody they love died from COVID, they're feeling very angry and resentful that others aren't taking it seriously. I've definitely seen that. That's another part of that is another added layer of their grief, right? That they see people without wearing masks and people that are in clusters together and people that aren't still believing it, if you will.
Yeah.
Anybody else? All right, Annie, we can go ahead and pull.
All right.
Sorry.
No, I was thinking too, we've had an incredible uptick in the phone calls from folks. We went from you know, maybe 1 or 2 call-ins a week requesting services to at least 1 a day, if not more a day. So we're already seeing this uptick, but the even if their loved one didn't die from COVID, just the sheer the talk, you know, when we talk to them is all about the isolation. And, you know, I can't go out and be with my people. I can't go outside and interact, and the fear that they might get it. So really isolating themselves. And when you're grieving somebody's death, you know, like, what do they say in all the material? Like, get out and try to be with people. Right? But they can't do that except on a Zoom room. And then there's also these people who are like, oh, I don't know how to use that technology. You know, so many people are happy to have it, but then there are so many people who can't or are not willing, you know, so it's just really, it's really hard, I think, is what I'm noticing.
Yeah, and wearing on people. When you look at from now to March, how many months that has been, the sheer volume of time that people have been isolated. And think about for a moment people that haven't had a hug since March.
Yeah.
And haven't had the touch of another person since March. And then you add grief onto that and not being able to go to a funeral. A very dear friend of ours, her mom died, and she wasn't able, you know, to go and be with her in the last days. And, you know, certainly there wasn't able to be a funeral. You know, you add all of that in, and, you know, and of course, that's what all of us are doing, right? We're attending to those needs as best we can via Zoom or WebEx or whatever it is you're using.
One of the things that I have a colleague who works in a long-term care facility, and she's recreation director, and she was almost in tears because she's watching the residents there who are elderly literally die of loneliness. It's not of COVID, it's not of, and then I also think how this cuts across, you know, all ages, even younger people, children who are not able to have social interaction with their friends, or particularly adolescents. And in a lot of communities I work in, where people were already overcrowded in their housing and under-resourced as far as Zoom or internet access. So, and trying to do remote teaching, learning, and then trying to get services through Zoom, and stuck literally in prison. There are many people I've talked to who say, like, I feel like I'm doing a bit. I'm doing a prison bit. There may be other people, but it's still an isolation from their lives, from the broader world. And sometimes the rebellion is, I'm going out, I don't care. And particularly for younger people who've been told they couldn't get it until they were told that they could, you know, but not even realizing they may be putting the people they love at risk as well. And so that's a sense of kind of social isolation, even if you're in a household that's overcrowded.
And April, you bring up some really good points that we haven't talked a lot about. Number one, being in a family, you know, crowded in and tired of probably the people you're around, right? Because you've been stuck together for months, but feeling alone within your family. And then you said feeling like, I think, how did you say it? Feeling held hostage, did you say, or feeling locked in?
Held hostage, imprisoned.
Imprisoned. When you're in an apartment building where the only way out, maybe you don't have a balcony, and the only way out, so you can't get that fresh air. You know, you can open a window, of course, but the only way out is to go down, you know, to get in an elevator, to go downstairs, to get outside. If you're how many ever floors up, well, when you think about getting in an elevator and COVID, for so many people, they don't want to take the chance to get in the elevator, to go down those floors, to get outside. So yeah, you know, that is a feeling of being imprisoned. And I don't think if you're living in a neighborhood and you have a backyard or a street, you can get outside and walk very easily. I don't know that everybody's necessarily thinking about the experience of families who are living in apartments where it's not so easy to get outside. You know. And
yeah, and I think that speaks to the guidelines that we have. And I know that Rachel is one of the individuals, we've all worked on the guidelines together, but it's really taken some thinking around how the language you use on the guidelines, right? Because many of our clients are located in apartments, are located in small spaces. And so thinking about not going into the bathroom, and we joke about that, but actually I know on at least 2 occasions my children have taken their Zoom session in the bathroom to find space. And so it's, and I know we had a light moment there, but that is a part of the demographics and the socioeconomic impact of rolling out Zoom sessions for me doing with children, some 40 odd children in urban areas. And then I might speak to 3 or 4 that have the back gardens that I know of in the UK. But for the most part, the back garden that perhaps some of us know of is bigger than the apartments that these families live in.
Yeah, Jacqueline, thank you for saying that. You're absolutely right. There are going to be, whether they're children, teens, or adults, people that need to use the bathroom as a means of privacy, right? So perhaps when we're talking about being, careful about your privacy, and if you are in the bathroom, just being careful about where in the bathroom you might be, or wherever your private space is, right? That you're just careful of your own, I guess, appearance on screen. But that's a really good point. There are going to be some individuals that the way to have privacy away from their family and participate in a Zoom group might be the bathroom. I'm glad you brought that up. And so you mentioned also language on guidelines and just being cognizant of that. Has anybody else? Oh, go ahead.
No, I was just thinking about just the time that it takes to complete those guidelines and to revisit them again as we encounter different things. One of my children, and there are 40 something of them, even though I haven't given birth to any of them, they're my children on my caseload. Thinking about where the children take those sessions again. And one of them, it's in the bedroom area on their bunk bed. And sometimes they're in their shorts and their little t-shirts, but having to have a clear, using clear language to them about keeping ourselves safe in the imagery of that, even though we're dealing with 6 to 9 year olds, even in their innocence that it's about keeping each other safe on that screen. And interweaving that language and educating. And so as you share, it's part educational, part meditation, part, all of those parts make up the Zoom sessions of what we are sharing. And what would originally be, it is a bereavement support group, but you are interweaving all these parts that originally we were not thinking of. And so it is instrumental to think carefully about the language, that we do not restrict others because of their socioeconomic, cultural, there's all sorts of things at play here. It takes that sensitivity when we are bringing this work together in these spaces.
Mm-hmm. And I'm wondering, Jacqueline, if you have an example of your guidelines, if you'd be willing to share them with the group, because I would love to see how yours are worded. And I think that they would be beneficial to others on the call if you'd be willing to share those.
Sure, we can share them, Pamela. That's not a problem.
Okay, thanks, Maria.
I don't have them right now.
Oh, no, you don't have to share them right now.
Yeah, but we're happy to share them.
Okay, yeah, you have my email, Maria, and then we also, Lauren can put her email in the chat and you can send them to Lauren as well.
I could also post them in the chat, Maria.
Oh, okay.
Would that help people?
Yeah.
Okay.
Yeah, it's great. Other comments from anyone? And then we'll be taking a break here soon. But other comments about anything that we've been discussing, whether what Jacqueline was just mentioning or anything up to this point?
It's very interesting. I'm looking at the PowerPoint slides, and you don't all get the PowerPoint. But when you get the PowerPoint, you're going to see that all of the points that we're making, we're working our way through this PowerPoint because we're living it, right?
Yeah.
I mean, we could sit here and lecture it to you, but we're living it, and it's the reality that we're seeing. One of the things I wanted to mention before we go on break, though, are a couple of like other just issues and considerations that we think about. I know with COVID, so there's the focus there. Prior to COVID coming on the scene, for the last number of years, we have seen overall an increase in suicide in the United States, more so in some very specific communities, but overall, the suicide rate has continued to increase, depression continuing to increase, and opioid use and overdose death has continued to be on the rise. And really in the last 10 years, like dramatically shot, just shooting up and continuing to just rise, right? That as that level rises. And so part of it is, and again, it's the question in my mind, and I know that there's different news reports. One day you'll have a report, suicide is, as a result of COVID, suicide is going up. But then you'll have statements where, we can't really say that because we don't know for sure that, is it because it was already on the rise? Is it, what is indeed the impact? What does that look like? And I know a lot of these numbers we may not get for a year and looking back on them. But they continue to be issues. And so again, that's a piece in my mind is it's not just what's happening because of COVID, but it's everything that has been and continued to happen and how that then exacerbates what we're going through right now. Those things didn't stop. They're continuing to be issues. And I think one of the points that, just in our research looking at this, very specifically when it comes to suicide, this was back in March, actually March and July, between March and July of this year, NAMI, the helpline, saw a 65% increase, just March to July, as this was starting out. And I haven't seen statistics on what that has looked like since then, but even that itself says a lot about just the onset of COVID. And again, all of these things were already going up, but they've seen a 65% increase since then. So that shows a spike to me in what we're seeing there.
Yeah, absolutely. And I agree with you, Andy. I think that this is one of, when we look at mental health and individuals' mental health, I think the reverberations will go on for years and years from this time period and into next year. I agree when you think about that statistic, the increase to crisis lines right now, even though there aren't hard and fast statistics for the suicide rate right now, I can only imagine the increase that we will see when you look at the reports that we're getting around so many different issues. I think it would be good for the next few minutes before we do take a break, if anybody wanted to speak to that and what you're seeing in your work and with your families.
Hi, my name is Rashida. I'm also a bereavement counselor at Calvary Hospital.
Hi, Rashida.
Hello. And just to add on many of the things that Andy said and we've been sharing here, although not necessarily hard and fast statistics, we can really see, at least I can speak to New York City, that it's very, very difficult for individuals to manage any mental health services that they may need as far as getting appointments, finding clinicians who are available, insurance, and the need to have some of the costs of seeking out mental health resources are often needed, and that's quite difficult to do. And individuals also, when we speak about our physical bodies kind of receiving the impact of what we're going through. So many people don't have the chance between taking care of children, trying to take care of elders in their lives, managing your work, whatever it may be. Many of which are in lower socioeconomic communities that's statistically correct, are the ones who had to continue to go to work, who didn't work in jobs where you could be in front of a Zoom, who were very hands-on, who were going into hospitals as part of custodial staffs, as part of being washers, dishwashers in restaurants, cooks, etc. So they had to be around in environments where there was a higher chance of them contracting COVID. So we have all of these things. Plus, we touched on briefly just the real racial tension and turmoil that was happening and continues to sort of happen, especially at the height of summer, and how people were reeling from that. I found that in my support groups, we had to figure out how we could create boundaries of talking about death related to the death of someone, but also the losses and the triggers that people were feeling. I remember someone in my group who was 60 years old feeling very triggered and thinking about being down south and having dogs set on her by two white men. This was a Black woman sharing this in group. And we really had to make time and space for the many, many other ways in which people were triggered during this time and how their losses were coming up. So I do think as far as mental health services are and this idea that it's there, it's available in many ways, that many individuals have obstacles that stop them from being able to reach out. And traditionally, we find, although a lot of churches and mosques and synagogues, places of worship, and other places where individuals get support are really trying to meet those needs, sometimes there aren't professionals in there or within the congregation who can really lead out these conversations. So people have been feeling isolated on many levels.
Yeah.
Yeah.
Rashida, no, go ahead.
I just want to echo a lot of what you said, Rashida. Particularly, even in those places, people can't have access to those houses of worship because of shutdown in the same way. One of my concerns, as I think about with the suicide rate, is really that we need to be cognizant of what's going to be happening with our children, our teens. And teens are already at high risk for suicide, but think of these young children who are growing up in an age of such death and, in a sense, destruction of the world that they knew, whatever. And many of these communities that are being hardest hit are the very people Rashida was talking about, are going to have disproportionate amount of death, particularly of children whose parents had to keep working or didn't have the social kind of buffers. And how do we look for that? How do we be aware of that? And how do we now begin to break down the inequities and break down the barriers to access to mental health? Because it's not as much stigma as it used to be. There's still some stigma, but it's more about actually being able to get services. Because before COVID, in many of these communities, it's like 6-month waiting list to get a therapist in a local clinic. And so to really pay attention to what we might be seeing, not only what's happening now, but what might be happening in a year or two from now, and then for a decade. Because I think of this is so akin to what happened with HIV. And when HIV and people were dying at high rates, I worked with children and families who had to do permanency planning. But the parent knew they had HIV and had to make provision and prepare their child for what might be their impending death. And there's not that here with COVID. COVID doesn't give you that opportunity, and that was difficult. And I think we've seen some of that in the young people who've dealt with that in the last decade or so. And there's going to be another long-lasting impact for another generation.
Right. Well, and like you said, the impact that will be disproportionate to many of our communities over other communities, and even just the conversation that needs to be had about all of these things, it can't be had at the moment because even just the unrest that has happened, and even the lack of just cultural humility, really, that just doesn't exist, and the how things have become. There's not a conversation around it, and so we have groups of people who aren't accessing care and don't have access to care. And even if you talk about just even self-care, that's even considered just a luxury to be able to think about self-care, right? And so, we on our all-day training yesterday, we talked about there is a very difficult conversation we need to be having in our country, but we're not having it. And as hard as it may be to have, we have to at some point, so that we can. But all of these things, I think, that are happening, it hasn't created space, certainly, for those conversations to happen. At least in my viewpoint and what I'm saying, it certainly has not.
I agree. And Rashida also brought up church communities, and some church communities aren't meeting now. Maybe some on Zoom, but it's still not a replacement, right, for one's church community. And did you want to add something, Rashida?
Yeah, I was just going to quickly add that something that I noticed and that many noticed, especially in the height of the summer and racial unrest and tensions, etc., is that surprising, not so surprising, the amount of trauma that it takes to be videotaped for the propelling of some of the conversations that needs to be had. And what we noticed in that, especially with like something like the murder of George Floyd, is that there's this whole rush and sort of like opening of the floodgates for people all over different fields to kind of talk about racial injustice, whether it's in the health field, or through education, finances, whatever it may be. And there's simply not enough time nor bandwidth to necessarily talk about all of those things in 2 to 3 months of process. So when it rises and impacts people in such a traumatic way, in addition to all the things that they're dealing with, some people just numb themselves and turn away from that. And others capitalize on that. We are the organization that doesn't do this, or this is how we're working towards it. But as far as really moving forward with those conversations and continuing to bring them up and having them and seeing how individuals are impacted in physical, body, mentally, how it affects their grief and coping in this time, it makes me wonder, at least, what is the next act of trauma that's going to bring it all up again? So it's very cyclical and unfortunate in the way that these conversations are brought up.
Well, because some of it just becomes rhetoric that there's no change that happens. In other words, the systemic issues, the processes, all of the things that we know need to change. What happens is people learn language and it becomes like, PR, and it's not PR, it's people's lives, right? So the conversation, it's interesting to me how when that conversation comes up, we have those conversations, but then we don't see the change that needs to happen. So I agree. It's sort of like, what's the next thing that brings that up, and it brings it to people's minds. And then lots of people change their language and they talk certain ways, but does it change the reality, I guess, and it's that social change that we need to see happen. And, so here in the midst of everything else that's happening, we have all of these things that are happening in the lives of people. And I think that was the point Pamela and I were trying to make by turning our conversation from healthcare to, well, what about society? What about people in society? And who are the people in our society? And how are the people in our society not only being affected right now, but these are long-seated issues, right? These pre-existed what we're dealing with right now. And what we're dealing with right now, then again, it adds to, it exacerbates all of these things that have been issues for some time. We're actually at about about 11:10, about 10 after the hour. Believe it or not, we've been going for about 2 hours. I can't believe it. I looked at my clock, I was like, what? What has happened here? It seems like it kind of went by quickly. I think we should take a break so we can all kind of get up, move around a little bit, stretch, whatever we need to do. When we come back, let's kind of start from where we just left off, and then we're going to move into Pamela and I thought we would like to lead a discussion on what if we were to frame a number of the things that we see happening right now in our society, and very specifically with COVID and what we're all dealing with. What if we were to frame that through the lens of grief? So far we've talked a lot about mental health, concepts, right? Physical health concepts. I think that grief bereavement has some way to speak to some of this. And so we wanted to kind of create sort of a framework for us to talk about this in the context of grief, and certainly enjoy some more robust conversation around that piece. It's interesting, in the last 6 months, I've probably heard the word grief used on the news more often than I've heard it in probably the last 20 years, right? Because somehow people are relating what is happening individually and corporately as a community to the fact that that's this situation of somehow we are individually and corporately grieving.
And Andy, we're hearing about the idea of grief for every single thing, right? Not, of course, just the death of somebody, but all of the collective losses that we're all experiencing.
So why don't we take a break? Why don't we plan to come back together at, let's see, try to get my math right here, at 25 after the hour. So we'll put a little reminder up on the screen. So we'll come back at 25 after the hour. Get up, move around, let's stretch a little bit so we can come back in and have some more time together this afternoon. All right.
See everyone in a few minutes.
Thanks, everyone. See you in just a little bit. You've had an opportunity to get up, move around, stretch a little, grab some coffee, step outside. I don't know, what it is that you needed in the moment, but hope you were able to do that, and certainly glad to come back together and continue our conversation. As we went into our break, we were having a discussion about conversations that we need to have. But also change that we would like to see. And I don't want to just move on too quickly. I want to pause there and see if there's other comment or thoughts about what we were discussing, and then we're going to kind of pivot and begin talking about putting this in the context of grief. So just wanted to open it up to see, or even just comment on anything that we've discussed so far before we press forward here.
Let's do a check-in, see how everybody's doing. More Zoom time, right? But hopefully having an opportunity to share with maybe some people that you aren't accustomed to sharing with is good. In addition to learning together. It's hard to come back and sit in the chair though, isn't it? I'll be the first to admit.
Well, I'm actually standing up now, so
I can do that, Andy.
I adjusted my position. I was like, I need to stand up for a while. So
I need to do that.
So if you see my desk drop as we're talking, I'm sitting back down. But for now, I need to stand up for a minute. Doing that along the way. Well, let's talk a little bit about grief and how we put this into context of grief, how we understand that. And I'd really like to start by sharing, and some of you, maybe if you've been on some of our other trainings, or you were in the training yesterday, some of what I talk about might be familiar, but I like to really lay a foundation when I think about grief by first talking about, like, really, what is grief? Like, what is it in our lives? Because to me, whatever we believe the nature of grief to be is certainly going to impact the way that we approach people who are grieving. It seems elementary, but I think it's true. So I would like to just lay a foundation of at least the way I understand grief and lay that out there. And I'd love to hear from some of you on how you believe, what you believe about the nature of grief and what it is in our lives, and the impact that it has, and what that looks like. For me, I like to start when I talk about grief as that I believe it lacks a language. I think putting grief into words is challenging. And over the years, I've heard people present on grief, and they'll say about children don't have the words to articulate, right, the feelings and the reactions that they have. And so quite often then, of course, children will play. The grief will come out in their play, or you'll see it in their actions, or their activity, or their art, or their ways of expressing, because it's hard for them to articulate. It's been my experience after a couple of decades sitting with bereaved people of all ages, we always like to say ages 5 to 105, that I think it's true for adults too. I think it's difficult for us as adults to be able to articulate what grief is to us. C.S. Lewis, in his book, A Grief Observed, and he was a great writer and a prolific thinker and this deep theologian, and he couldn't even come up with the words to describe grief. He described it this way. He said, "No one ever told me that grief felt so much like fear." He wasn't saying grief was fear. He was simply saying it's like fear. And it was a way of trying to say to people who didn't know what he was going through, this is what it's like. He's trying to think of something that is a common human experience that might relate to grief. But in a lot of ways, people who I've sat with, it's hard to talk about it. It's like this thing that's just there, right? That just kind of sits here. And in some ways, sometimes it clouds everything that we see. It makes it hard to concentrate and to focus and all of those things. So one of the metaphors that I like to use when I talk about grief is I like to think of it in the way that I think of a storm that's coming in the distance. So if you could, for just a moment, just kind of humor me by picture in your head just a storm that maybe is coming in the distance, and you can see that, those big thunderstorm cell, that you can see it in the distance, and the sky starts to darken a little bit. Maybe you're on the porch of your house or apartment, or you're standing outside somewhere. So when you see this storm in the distance, what are you experiencing? And just, you know, if you want to unmute and say, shout a word out, or if you want to put it in the chat, what are you experiencing when you're standing there and you see that storm in the distance? Anybody? I'm gonna pop open where I can see the chat too.
Dread. If I'm not in the house, it's dread if I see a storm coming.
Yeah, quite often dread. Yeah, and I've heard people use the word, this sense of foreboding, right? Like it's something's coming. Will I be safe? Lauren put in the chat. I've had people who have said to me, I actually get excited. I love to see storms come in. So some people, it excites them. It's kind of exciting to think about. My wife's one of those people. We live in South Florida. So you can certainly watch storms come in, but you really do need to take shelter because there's usually a lot of lightning and things like that involved, and it's not safe. So there's been plenty of times where I've gone out and said, all right, it's time to come inside now. You watched it come in, you know, enough. But she gets excited. It's some awe. Someone used the word awe, you know, that it creates that sense. Have you ever been watching a storm come in and then you feel the temperature drop 10 degrees, right? And the wind changes directions and you can feel that cool air on your face? Or have you ever smell a storm, right? The smell changes. My grandmother used to say, I think it's going to rain today, my knee's aching. She had this achy knee and she knew, like she could tell the weather by the ache in her knee. The reason why I think about it this way is, to me, grief is like this. Our experience of grief is like the experience of a storm. And it's because grief is an experience. It's not just something happening in our head. And it's not just a series of emotions, just a bunch of emotions that are part of it. To me, grief is something that is all encompassing of who we are. And we grieve to the depths of our soul. Khalil Gibran, in his book, The Prophet, and the chapter in the poem that he writes about joy and sorrow, and how the two really are two of the same thing. If you remember how he describes sorrow, he says, sorrow digs deep caverns in our soul. And to me, the first time I ever read that, I thought, that's it. It's more than all these other things. We list sadness and we list all these symptoms for grief. And you notice how the symptoms are all encompassing. They're everything. They're mind, body, spirit, social interactions, behavioral issues, all of that. Because grief isn't, again, it's not an illness. It's not a condition. It's an experience, and we're living through it. Just like you experience a storm and you live through that. You live through grief. And that's to me is how I like to understand grief. So when people ask me, what was your grief like in your life? I say, it impacted all of who I was. And in some ways continues to, I continue to have that as part of my life, but I've incorporated it into my life, right? Even when people use the word resilience around grief, and they say we can be resilient. I get what we're saying about resilience. So, you know, don't get me wrong here. I think resilience is important. But for me, I've never been resilient when it comes to grief because it has impacted me. For me, it changes me. So if it's resilience, it's a resilience where I don't bounce back to the way I was. I'm impacted and changed because of what has happened, right? So just thinking of grief in that way. And so further, Pamela and I, when we were writing our book together, we were trying to conceptualize. So if grief is this experience that we're living, then what is that nature? What is the nature of grief in our lives? And I think there's a number of ways we can define this. I certainly believe that grief is a natural, normal experience. I don't believe it's a pathology, right? But However, there are lots of things that grief might be in our lives, right? And so Pam and I conceived of what we call the universal realities of grief. And we have 6 of them that we came up with. And there certainly could be others, but these are the 6 that we came up with. And I wanted to share these just up front. And then I'd like to open it up and just hear from all of you. What are your experiences? What are some of the metaphors that you use to talk about grief and what grief is? And I'd also be interested in hearing from you about what you believe our role as bereavement care or mental health care professionals or social workers who are working with bereaved people. What do you believe our role is as a result of knowing what the nature of grief is? And so let me go through these rather quickly here, and then I'll open it up and want to hear some discussion. So in our estimation, we came up with 6 what we call universal realities of grief, and we believe it's true for anyone of any age. Doesn't matter whether it's a child, a teen, a young adult, or an adult. We believe these are true for anyone. So the first one, in our opinion, is that grief is personal. And what we mean by that is it belongs to the person who's grieving. It's their grief. All of us have our own story of where we've been and who we are and who we've become as a result of where we've been, and we're that person. We all have our own temperament and personality and the way we understand the world to work. I like to even use the phrase, everyone has their own way that they feel most comfortable being in the world. And if that's true, I believe it's true about grief. Everyone has their own way that they feel most comfortable being with their grief. And we would all know this. You would agree. You'd say, well, yeah, I mean, I've had clients who come in and no one's really exactly the same. Though we have similarities and commonalities, we all have our own way of doing that. And for me, when I think about grief, if grief indeed, if it's true about the nature of grief, that it is personal, is that tells me as a caregiver that it's not my role to take someone's grief away from me. I don't have that power to go in and take that away, right? And we all, of course, know people who come in to see us and they say, everyone I talk to about my grief, they just try to fix me. I just want, is there someone who would just listen to what I'm saying here? I'm trying to work through some things, and I don't need a bunch of trite answers. I need a place where I can bring that. Right? So that's the first one. Grief is personal. The second one, we believe, is that grief is transitional, and what we mean by that is that grief has motion to it. In other words, it's not stagnant, right? That grief is moving somewhere. That we're going through life in one way, and a death happens or a significant change happens, and from that point we now are transitioning to the way life will be now. And so it's this transition from one way of being to another. And in that way, we're sort of transformed through that experience. Phyllis Silverman said it this way. Phyllis Silverman, who wrote about continuing bonds. Phyllis was a psychotherapist and spoke a lot about children's grief, particularly, and was even part of founding the Children's Room in Boston, part of that organization. And she said always, I remember her quote is, grief is not an illness, grief is a transition. And so really playing off of that view that's something that grief is, it's this experience. I like to think of it as a process of becoming, that I'm becoming this thing because of the things that happened in my life. One of my favorite Indigo Girls songs is a song about, it's called Becoming You. And the song is about that all that it took to become you. And that's part of your story. and it will always be part of your story. And in some ways, it will be part of you. And so how that grief, that transition is part of who we are. So what that also tells me as a caregiver is, if I'm working with someone who's bereaved and they come in to see me and they're taught whatever they're talking about in that session that day, there may be things that we can identify and say, yeah, we can work on these areas and that type of thing. But I will promise you, when they come back in 3 weeks or 4 weeks or 2 weeks, they're going to be talking about different things because grief has this motion to it, right? So it's kind of like, it's a little tricky. It's hard to create a care plan for it because it's elusive in that regard, right? Because it's a transition, it's a person's becoming. The third reality, and again, in our opinion, is that grief is both seen and it's unseen. And another way of saying that is that it's visible and it's invisible. It's both. And I like to use the illustration, we've all seen it 100 times, the illustration of the iceberg, where the tip of the iceberg is out of the water and the majority of the iceberg is below the surface. And it's certainly true of grief, I believe. That the nature of grief itself is that people come in and they just show us the tip of the iceberg, right? That someone's expressing sadness is just the tip of what is really going on down inside of them and what that means in their life. And little by little, people will show us those things. But there's also this balance between trust and vulnerability, and how vulnerable do I want to make myself to this person, all of those pieces and parts. And the other thing about grief, it is seen and it's unseen, because some of grief, I think, is even unseen to the person who's grieving. Just unconscious of some of those things, and how a loss in my life today somehow becomes entangled with losses in my past, right? And I'm not even realizing what that looks like. So the grief in and of itself is seen and unseen. And so one of the things that it taught me, early on in my career, was I recognized a person may come in and say, I'm coming to you because I can't sleep at night. That's not the real problem. The real problem isn't that they can't sleep. It's something else, right? That's not seen yet, but they're putting out that this is the problem. Or another example is families would come in and say it was a mom or a dad who died, or a partner who died, and the surviving partner or surviving spouse says, well, my 2 younger kids are doing fine, but my older kid is just having horrible problems. Grades are down. He's crying all the time. The 2 younger, they're just fine. They're going along like nothing. And so the assumption becomes, because there's not visible behavioral issues going on, that there's not grief happening. And so what happens quite often is the kids who seem to be doing fine don't get any attention when it comes to their grief, but they're still laying their head on their pillow at night and they're grieving alone. And it creates that sense of isolation, you see. So I think it's significant to think about grief as seen and unseen. And I won't go into it too much right now, but there's a great interview with Stephen Colbert and Oprah Winfrey that I think drives this point home. And if you haven't seen it, it's probably 10, 15 years ago now that they did this interview. But Stephen Colbert's two brothers and older brothers and father died in a plane crash when he was a young adolescent. And he talks about that experience. And the way he discusses it is basically, in his teen years, no one would have even known that he was grieving. But by the time he got to college, he said he lost a bunch of weight. It was very visible. And so it can be both in our lives at different points, right? The next universal reality, we believe, is that grief is a shared experience. And some people have called me out and said, yeah, but you said it's personal. You can't, what are you doing? You can't say both. But it is both. It is a personal experience, but it really is also a shared experience. It's corporate in that regard. I mean, think about the families that we see It's corporate in families because we bump into each other, right? How many you see spouses who are grieving and they'll say, well, he's not doing it right. Like he doesn't show any emotion, or she doesn't show any emotion. She's just stoic, or you know, I want to talk about it, and he or she doesn't want to talk about it, right? It's that the differences impact how we feel about our own grief. And so we bump into each other. The other way it's corporate, though, is that there are similarities. There are commonalities in how we grieve as human beings. And because there are commonalities, that's why support groups work. That's why peer support is actually effective, is because we do have commonalities. And isn't it great when you hear someone speak truth to your experience? That they say things where you're like, yep, this person gets it, right? And so grief is a shared experience. And of course, again, then the importance for me as a professional or someone providing care is that it does tell me that when I'm doing any kind of work with children, I need to also be talking to their caregiver, to the adults in their lives. And it's not just even the adult that lives in their home, but somehow having conversations with the adults everywhere they live and play. School, their coaches, their teachers, their neighbors, you know, their minister, whoever those adults are in their lives, they're part of that community. And I know you've probably had this experience when I was working in Birmingham, Alabama, and running a bereavement center that was in inner city Birmingham. I would run into a lot of situations where I had kids who would catch the city bus to come to the Amelia Center because their parent was not involved in that process. And I watched how they struggled because there wasn't that parent-child interaction, right? And we know that doesn't always exist. It's something that many of our children are struggling with and dealing with in their lives. And so just recognizing the importance of the community in which a child lives, in which a person who's coming and sitting with you, we talked about a minute ago, cultural humility, recognizing that the person sitting in the room with me is part of a greater context and community, and maybe greater culture. And that impacts the experience this person's having. And if I'm there facilitating a process for someone, I have to become a little bit of a learner. Not that I'm asking the person to lecture me and teach me all sorts of things, but I have to learn to listen and pay attention to what they're bringing into that time and that space, because they're the one who's creating the content for what we're doing in bereavement support, not me. I'm not coming in and deciding what the content's going to be. They do that, and you get that by listening. The next reality, and we have two more. So the fifth reality is that grief is integral. Grief is integral. And by this, we mean that it is an integral part of our lives, of our development, of our transition, if you will. That transition, that grief is an integral part of it. Meaning, in some ways, it's a necessary part of what it means to adapt to the experience of loss in our lives. And so I'll take us back to school just for a second. And I promise, just for a minute, because for me, it helps to put it into context of things that, I don't know, I learned when I was in school. And one of them is Piaget and learning theory. This is, to me, it really helps to solidify this idea. Piaget with learning theory talked about how we adapt to new information, right? How we adapt that into our way of understanding the world and how the world works. So Piaget said we do this by, we have schemas of how we understand the world to work. And so he said an infant, one of the schemas an infant has is, if you take a rattle and you put it in the infant's hand, what's it going to do? It's going to grab it. Then where is it going to go? It's going to go in its mouth. It's going to bite it. And so Piaget would call that grab and bite, and that's the schema. So you take this infant and you put the infant on the floor in the living room, and it's crawling around the floor, and your watch falls off of your arm. And the infant's never noticed the watch. So it's a new object. The infant's going to engage the new object with an existing schema. And Piaget calls that assimilation. That the infant's gonna try to assimilate this new object into its understanding of the world by using what it knows. There's the old phrase, if you don't know what to do, you do what you know. And that's really assimilation. So the infant grabs it and bites it, and it works. And the infant doesn't have to go any further. It's assimilated, it's adapted the new object by using the existing schema. The same infant's crawling around the living room floor and comes upon a beach ball. What's it gonna try to do? It's gonna try to grab it, it's gonna try to bite it, but it can't, it's too big and it bounces away. And to me, this piece is what I think is integral to adapting this into the infant's life. Did y'all see the movie with Tom Hanks, Castaway? Remember the movie Castaway where he plane crash and he's on the island? Okay, all right, it's very long, I get it. We won't go into like movie critic about whether it was good or not good, or there were great things about it and some that was a little bit long. But I will say this, the scene that to me was one of the most significant scenes in the movie, and there were many I thought, but was his first night on the island. The next morning, he's on this island, he's a FedEx guy, he only knows how to ship things and that's what he does. The boxes from the plane that crashed, it was a FedEx plane, it's all washing up on the island. Do you all remember what he did to the boxes initially? He started stacking them and sorting them by zip code. So he's on a deserted island, and what does he do? He does what he knows, and what he knows is how to sort and it's how to sort packages. So he does what he knows, and it's a hilarious scene because he's just sitting there doing by zip code and organizing it on the beach. And a few scenes later, though, it shows him tearing into them because he all of a sudden realized what he knew wasn't going to work for him. He had to figure out another way. And to me, this is where this struggle with the beach ball for the infant struggles, and in time, but it's always through struggle. Struggle is an important piece of it. Through struggle, the infant comes to a place where it realizes it can hold and it can bounce the beach ball. And Piaget calls that accommodation, right? And that's how we have to accommodate our understanding of the world in order to adapt this new object into our existence. And to me, that is a big part of what grief is, just the nature of grief itself. That it is a process of accommodating and adapting this new object. And it means that I have to change some things in order for me to live with this reality and to accept this reality into my life. And so that's what I mean when I say grief is integral. It means that the struggle is actually a part of how a person is adapting. And so for me as a caregiver, it's taught me all these years that when I'm providing support to someone who's grieving, my end game is not to remove their grief. My end game is to not, replace it with bliss or happiness, right? My end game is to journey with them and help them to find ways to cope with and to be with their grief and be with that struggle and to incorporate that into their life as they move forward in their life. Because we all know people who get stalled out because they're looking for a way to get rid of it. And the reality is we can't get rid of it unless we can just erase that person from our existence. And that's not a possibility. And so it becomes about incorporating that experience into our experience and moving ahead with our life. I think it even applies. I have people who talk about guilt and regret in grief. And you know how frustrating it is? I'll speak for myself. I've had that, and I've had guilt and regret in my own life. And it becomes so frustrating to me when I go to someone to share it and they say to me, oh, you're not responsible for that. No, you shouldn't feel that way. And they try to talk me out of it. And it's frustrating because I'm like, all you did is tell me that I can't tell you this truth. I'm trying to tell a truth here. And trying to talk me out of it doesn't change the fact that I feel this way. So to me, it's a perfect example. When someone comes to us and they start talking about guilt, as a support person, we don't try to talk them out of it. We lean in and we say, tell me more about that. Because that's what that person needs to be able to process through that. And so the last universal reality we believe is that grief is enduring. And by that, we mean that time really doesn't matter as much when it comes to grief. Grief is something that endures in our life, right? And it's kind of tied to that sense of transition, because we did transition because this happened. So how many people have told you, I had a death when I was a child, but if I want to, at any point, I can find myself right back into the depths of grief over that loss so many years later, right? Because grief is something that endures in our life. It doesn't have that ending point. I will say this, I've learned to be cautious in how I share this with bereaved people, only because sometimes people will hear grief never ends. You ever heard that phrase? It's not very hopeful. Like it's actually scary. And I've had people who said, gosh, you mean I'm going to feel this way the rest of my life? Right? And that's not what we're saying when we say that grief is enduring. It certainly changes in intensity and substance and things like that as our life moves along. But it doesn't just change because of time alone, right? There might be things that we do in the midst of that, learning to cope and some certain behaviors and things that we put in place that can help in that process. So I try to be cautious how I say that. But so in our mind, those are sort of the six realities that are true about grief. Again, there could be other ones, but just the grief is personal, grief is transitional, it's seen and it's unseen, it's a shared experience, it's integral, and it's enduring. And it's just the way that I conceptualize it, and it's actually helped me in my career as a professional to say, well, what is my role, and what does that look like? So with that, I just wanted to pivot and open up to you, and maybe as I was talking, you were thinking about your own concepts or the way you've understood or experienced grief, or maybe you have a question about what we kind of just talked about. I'd like to open and see who would like to jump in or chime in on your experience with this.
I'll speak.
Yes, please.
Yeah, I agree with you. I get the metaphors that I use are orientation. Things are moving along okay. Then we get hit sideways and we're disoriented, and then we find a way to reorient so that we feel at home in the world and in ourselves. And our job as therapists is simply to journey, as you said, and to help people that get stuck in certain places, and also just to provide a quiet example of hopefulness that it is possible to be healthy and more whole someday. So that's my dominant metaphor. That, or having the ground pulled out from under you and free falling and getting used to that almost becoming oriented in that free falling. That that's the endlessness of it, but that's a little dark. But
yeah. No, but it and thinking about how that applies even to just our situation, even as a society and what we're going through right now. Yeah. And I think disorientation is a great word to put to apply to that. At least it is for me. I somehow connect with that word.
Yeah. April mentioned about being a companion, and that makes me think about Alan Wolfeld and all of his work around companioning. Great. It's another good way to look at grief and our role. on somebody's grief journey or path?
You know, I took part in a few years ago when I was the CEO of National Alliance for Grieving Children. I was part of a meeting that convened in Washington, D.C. at the Center for Native American Youth. And it was the culmination of a year-long study that the Center for Native American Youth had conducted. And what they had done is, our tribes, there's hundreds of tribes around the United States, right? And so, how do you talk about Native American bereavement when you're talking about all of these hundreds of tribes that don't necessarily all operate or function or have the same experience? But they took a year, and what they did is they went and interviewed chiefs of the tribes. They interviewed tribal members. They interviewed teenagers and children, parents, and the research was conducted by Native Americans, right? So they were embedded in the communities as well, and they had this coalition that was doing this study. And I thought, there were a lot of things that were significant, and it was almost surreal to be sitting in that moment and watching a Native American woman present what is bereavement among Native Americans. And something that she said has stuck with me, and it somehow, I think, is appropriate to our conversation today. And what she said is, what we discovered is that in the Native American community, the word bereavement doesn't just apply to an individual. She said, we are bereaved people as Native Americans. We have lost so much as a people that we are bereaved. And if you're going to she said this, if you're going to understand how to provide support and care, how to do anything about the rise in suicide among Native Americans, or the rise in depression, if you're going to be able to do anything to be of any assistance or help, you first have to understand that it's not just about the individual, it's about our community, and we are bereaved. We are bereaved people, and our children are born into a bereaved community. And I thought that was just powerful, and I don't think I'd ever even conceived of it that way. And I have walked away from there saying, wait a minute, we have numerous communities within our greater community that are bereaved communities. And so I got thinking on this, that's why I got thinking on this idea of, we talk about the issues that we see in our society with using so many terms. We talk about it from a mental health standpoint, talk about it from a physical health standpoint. I'm not saying we don't need to, but how can we apply that idea of being bereaved, of grieving as a community? And somehow there's a context there that I think is important to the public dialogue. So I don't know if anyone has thoughts around that, or again, just how you conceive of grief in relation to what we're all going through at the moment. Different experiences.
Andy, I really appreciate you sharing about the concept of that we are bereaved people as our community of healthcare workers, and thinking about our healthcare workers in these United States and how many of them are come from the Black and Brown communities that are already grieving. Some of our colleagues have referred to this ongoing dismantling that's going on in these United States, and how this concept of these bereaved healthcare workers that are continually going back into the trauma, right? As we think about the hopes of the vaccine, etc., that they have experienced and continue to experience these traumas, and how those of us that have the power in management, budget management, how we engage this part of the workforce that some people have alluded to here, that it's difficult to engage the A's, the B's, etc., in terms of categories of characters. But these members of our communities are here within our hospital and within these organizations. They are the backbone of what functions so well here, right? Globally, the same is the narrative in the UK, that many Black and brown many of our nurses are Black and brown in the UK, but how do we engage them in thinking about the trauma that they have faced? Because so often that we put that on the back burner. And so just thinking about that, what do we do with this knowledge that we already have, and how we orientate it to think about reaching into those communities, because we do not have enough Black and brown counselors and therapists to go in to speak to the Black and brown community. It takes all of us as a village to go in and do that work. And so it's more inclusive, because that storm is coming, that reality of the trauma is coming, that the healthcare workers are going to be speaking of that more, and they're going back to these communities that we spoke about. We spoke about imprisonment and using language like that, that they're going into that. So there's double layers of trauma that's going on there. What do we do about that for those of us that have the power to think about the ways that we operate in our departments and lead, offering care, self-care to these sometimes hard to reach communities? But I think perhaps some of us have the knowledge already. You spoke so beautifully about the Native American communities, but we know what is unraveling here in the States, and how that functions and plays a role in 2021. We shall see.
And Jacqueline, what I'm hearing from you is the idea of trust, right? And communities have to have trust in mental health counselors and therapists coming into their communities to help. And I'm wondering if you would like to speak to that some, because I think that would help all of us who would like to help in communities and maybe feel that we sometimes struggle to gain the trust. Or if anybody would like to speak to the idea of trust and building those connections in the community, because I agree with you, there aren't enough mental health counselors available to help in all the communities.
I'd like to. I didn't know if you want to speak, Jacqueline.
Yeah, April and Jacqueline, both of you.
I work with a program that deals with gun violence in communities, and it's called Cured Violence, and strong messenger program. And one of the idea is that you need to have a credible messenger, a credible witness to engage with the community. And I think it's similar with the study with the Native American community. It was Native American people. And I'm quite sure not everyone was a clinician, not everyone was, but there are many roles in which we overlook people in the community because we assume they don't have the credentials, whatever that is, to partner. And so I think we need to check our assumptions about, what does it mean to be able to help a community, and also to assume that a community can help itself when given the tools.
Right.
And we're not going in to fix or save the community. We're going in to maybe remove barriers to the community, finding its own ways of healing, and provide tools and resources, but not to fix or save communities. And the idea of being credible is actually being connected to people in the community and creating partnerships, not a top-down kind of hierarchy. I think that's so important, because otherwise, we won't be able. I don't know if the communities are hard to reach. I think we create this assumption they're hard to reach because we find it hard to figure out how to enter into it. It's sort of like when I was learning to be a clinician, it says if you got a difficult patient, the problem is you most likely than the patient.
Mm-hmm.
It's something about you that is blocking your ability to find a way to connect. But we label communities as difficult, then we put the blame and the onus on those communities. And I think we need to step back from that and look at new and innovative ways
Mhm.
of engaging different types of expertise in the community. Because, yeah.
Yeah, and in April, and Andy, just a second, I just wanted to say, and in my case, I wasn't putting a qualifier on there as a difficult to enter community. I was more speaking from the angle of connection and creating connections and creating bridges in communities. Andy?
Yeah, I was just going to say, April, just to speak to what you're saying, to me, it also speaks about infrastructure too. So I had an experience where I learned this lesson when I was at Amelia Center, and it's things that I might have known in the back of my mind, but it came to the forefront of my mind, and I realized, wait a minute, it's even how we view the community at large. You know, so let's take it as service area. Let's say, you know, if I'm a hospital and I'm serving the entire area that, you know, that's surrounding this hospital, this is my service area. What does my service area look like? And does my organization look like this, right? Because that's the true nature. It's more about then it has to do with policy and procedure and all of these things that are part of that. So for me, it was just a small conversation I had with one of my board of directors at the Amelia Center in Birmingham, Alabama, and he was an African American man. And when I had board meetings, I would stand in the lobby and they would walk through and I would greet the board members coming in. And in our lobby at the Amelia Center, we had this beach scene. It was a mural painted on the wall, and it only had 2 children on the beach. There was a little white boy and an African American girl, and that was it. And you didn't see their faces; you just saw them from behind. Right? And that was all that was on the beach. Well, he was walking through, and he stopped with me for a minute, and he said, "Before I go in," he said, I'd like to share something with you, and I don't want you to take it the wrong way." He said, "But I want to share something with you from my own experience." He said, "You know, I've grown up in the South, you know, a black man, and I was a black boy, and all through my childhood, I never saw myself depicted in images like this. Like I never saw myself. When I saw myself depicted, I was a criminal. I was you know, something. And there were these negative images that were depicting me. And so here's what he said to me. He said, "If it's possible, and you do any work on this mural," he said, "I'd sure love to see myself on that beach with those others." And that's all he said. And he went on into the meeting. And for me, you know, it became this thing of like, what are the institutions we've created, and do our institutions reflect the people who certainly that we're serving, but also the people who we're hiring, who are serving the people that we're serving? And so to me, that's a big part of the equation, and it's how I kind of think about community. What that looks like.
I appreciate you sharing that and the systemic piece, because the other thing I just wanted to say briefly is also that we need to look at, as a profession, how we have treated communities of color, how we've treated, you know, Black and Indigenous and other peoples of color. Oftentimes in the mental health profession, if it's a white family, they're like going to services because they recognize a need. But so often the mental health, at least my experience in New York has been, we send people of color who are problematic to see the social worker, to see the psychiatrist, to fix them, to change them. And so a lot of images, a lot of distrust, because it's not seen as a service for the person who may be in pain. It's seen as, we need to stop them from being a problem in our schools, or in our communities or in our jails or what have you. It's a sense of social control. That's history that we also have to look at. So if we're trying to enter into communities, how are we trying to enter into these communities, and what messages are we coming with, and sometimes inadvertently or directly saying? I mean, there's a lot of distrust of health systems for people of color, because of historical reality, which I think goes back to being a bereaved people. And to not connect with that, it's going to be difficult to think about, how do I enter into with any client? If I work with a client who has been physically abused, I'm going to be mindful of how I carry my body.
Right.
Because I know their history. I'm not saying there's something wrong with them. No, I'm saying I know your history, so I'm going to be mindful of how I carry my body, not making maybe swift movements or things like that, the tone of my voice, because their history has told them they have to be on alert.
Yeah.
And so that's another thing about making connections.
Yeah.
Absolutely.
Yeah. Thank you for that. Any other thoughts just around, well, any of the things that we've talked about, but this idea of grief and what grief is in our lives and how we frame, again, our current experience in the framework of grief?
In our communities, whether it's grief individually or in our communities.
Right. We wanted to spend a minute, and we can certainly come back to this. We did want to spend a minute and talk a little bit about children and teenagers in the midst of this, and just grief and the impact on them. So we kind of want to pivot for just a moment and introduce this into our conversation here. Pamela, do you want me to?
I want to go ahead and pull up the slides, and I'll just go through those. Again, recognizing that so much of what we're covering today, some of it's, quite frankly, stuff you know quite well, and other is new as it relates to COVID and everything that we've been going through. But really framing our entire discussion with that lens of COVID and really what we've all been going through. It's interesting though, having just made that own statement myself, I'm just always aware of people that have had somebody die and it wasn't COVID related, and how they are feeling in a lot of ways left behind because everyone is talking about COVID. Kids and teens are experiencing this as well as the adults and their families. COVID. Well, my dad died of a heart attack, so don't my feelings matter? And my dad or my mom died in a car crash. It wasn't of COVID. And or what about all of the families who had somebody die within the year before COVID? And even before, could have been within the last couple of years. And they're deep in their new grief. And all of a sudden this pandemic comes along and everyone's talking about the pandemic and the coronavirus, COVID, and they're not asking them how they're doing anymore. Everyone's talking now about this new thing that has arisen. How does that impact our families and what they're going through? Feeling left behind is tough. You can go ahead, Andy. That's fine. I'm sorry if you hear my doorbell. I'm aware that a lot of us are working from home and somebody is at my door, and hopefully they'll not keep ringing my doorbell. So I apologize for that. Most of you who are working with kids know the importance of telling them the truth, but this is probably one of the most important things that I feel that Andy and I, whenever we give a presentation that we talk about, is the critical importance of telling kids and teens the truth when it comes to the person or the people in their lives who have died. You want to take into consideration a few things. You want to take into consideration how old they are, and you want to take into consideration their life experience, right? Because you can look at a child's age and you can look at their, where they are developmentally, but really look at the life they've lived And what have they endured prior to the person dying, right? What has their life experience been like that informs really how mature they are and what they know about the world, right? I find my experience of all of these years in working in this field is that grieving kids and teens tend to be older and wiser and more insightful because of what they've been through, not only leading up to the death, but of course after the death, and being within their families and living in their families. It's important to answer questions openly and honestly. It's important that you gather all of the kids together of all ages, you know, from the 3-year-old up to the 17, 18-year-old. If you have, you know, 3, 4 kids in the family, get them all together at the same time and tell them the same truth at the same time. The teenagers, of course, will have more questions and they'll want to know more, and you can certainly have additional conversations with your teens. But we do recommend that the younger kids know the information at the same time that the older kids know. You'll want to use language that is understandable for younger kids. We always say, you know, tell them in bite-sized, age-appropriate pieces of information. But it's important that parents and adults and caregivers don't put their older kids in the place of being a secret keeper. And, you know, parents and adults don't mean to do that. They really don't. But by telling just your middle schoolers and your teens the truth, but not telling, you know, the 5 and 6-year-olds the truth, that's what ends up happening. Those older kids have to carry the weight and the burden, really, when you think about it, of knowing the truth. And younger kids do end up finding out, and they find out in a variety of ways. You know, think about when we were younger, if we wanted to know something, it was pretty easy to find out a secret within our household. I would say even if our family wasn't grieving, it was pretty easy to find out something that the adults were talking about. I would just hang out around the corner and listen from the other room, or, you know, listen from behind a closed door, right? It's pretty easy to hear what's going on in a family, and especially if the adults are grieving, they're most likely not paying attention to what they're saying on the phone or saying to other adults in the home. Often cousins know the truth and neighbors know the truth. So many people know the truth that kids hear secondhand information. And the most important thing that I've always stressed to parents and to the adults and the people, the guardians caring for the kids, is that you want them to be able to hear the truth from you, not from all of these other people or other kids in their lives. You want them to be what I call the inner circle of truth. And basically, where we're hearing it from you, that creates trust. And it also says to the child or the teen that they're important and that they matter and that their feelings matter. They're important enough to know the truth. And we see this with families when there's been a suicide death, homicide death, overdose death, much more often than if it was a car accident or a death due to cancer or heart attack, right? Some of those stigmatized losses are where families want to protect the kids. And their first reaction might be to not tell them the truth. And part of our role is to help the families understand that kids fare better and do better in the long run if they know the truth and if they hear it from you. The other part of that is if you as the adult aren't, meaning the parent or caregiver, aren't the ones telling them the truth, if you're not the ones telling them, they're not hearing it in real time. So they're hearing it delayed, right? And so you as the adult, or maybe the older kids, you're able to adapt to it, adjust to it, to begin to grapple with it, really, when you think about it, ahead of the kids who find out later. And so we just recommend that everyone knows the truth at the same time, and that you answer their questions as honestly as you can. If there is something that you either don't know the answer to, or you're not ready to talk about yet, it's okay to be honest there and say, I don't know the answer, or I'm not quite ready to talk about it, but I will talk with you about it, you know, in the coming days or weeks. All right. And then Andy, you can leave the slide here, but as far as telling the truth also, I would say tell the truth around COVID and around anything that you know going on with COVID, because kids have a lot of anxiety and a lot of fear around contracting COVID or the people they love contracting COVID. They're worried about people they love dying from COVID. They're worried about themselves dying from COVID. And one of the things with grieving kids and teens is they not only worry about themselves dying, but they worry who else in their life will die. And that's a really common reaction that we see in bereaved kids and teens. So a few other things about grieving kids. And again, we acknowledge and realize that those of you working in bereavement know all of this, but we just wanted to include it and look at it from the lens of everything that we have going on. One of the things that I would say that I've been so sad about is the fact that so many kids aren't able to be with their friends, and they're not able to be in their schools, and they're not able to be just with their cousins or, with their church communities. They're not able to be out riding their bikes and running around and playing and just doing all the things that kids do. And again, it's different for every community, it's different for every family, but by and large, so many kids are very isolated. And when we think of isolation, we talk a lot about older adults being isolated. I think of all the kids who are isolated and all the teens who are isolated. And really just not able to do all the things that kids do. And why is that important when we're talking about bereaved kids? Well, it's one of the main ways they work through their grief is to be able to get outside and play and to be with, their peers. They're not getting that opportunity, at least in the same way at this point in time. Andy, next one. And we always include this slide just about, the nature of grief and that people, something I say when I'm sitting in a circle with kids all the time, people die, but our relationship with them doesn't die, and our love for them doesn't die, and our caring for them doesn't die, and our memories and our connection. And really what I'm talking about is continuing bonds, right? That connection that we keep. But sometimes just saying it out loud for kids that, that we'll miss them for as long as we live is a relief for kids, because they're already thinking those thoughts, but maybe no one has said that to them. And I'll invite kids to share not only the things they miss, but the things that they love about the person and the things, their feelings about the person that are within them, so that are within the children themselves, that they feel will never die. Okay. We'll go to the next one, Andy. And we certainly know, just like adults, kids grieve so differently. And if you have a family with 2 or 3 or 4 kids in it, most likely you're going to have entirely different grief experiences with the kids. You might have some families where a couple of the kids are grieving similarly. One of the things that I've noticed, though, is that, and this is tough for parents, they often want to figure out how to help child, their first child, their middle child, and their last child. And I say the best way to help all the kids is to ask each of them how you can help them and basically what you can do for them, and find out what they need. You might have one child in the family who really wants all the photographs out. You might have another child that doesn't want to see the photographs. And you just have to negotiate within the family and help them figure out what will work for them. One story that I tell is a little girl in a family. Their dad had died of a heart attack, and it was sudden, and he died right in front of the entire family in the entryway of the home as he was getting ready to leave for work, and they were all there and they all saw it. Family of 3. Well, she wanted all of the photos kept out, and she put photos everywhere throughout the entire house. And as many as she could find, she just put them throughout the house. And one of her siblings didn't want to see even one photo in the house. And they were fighting and arguing about this for quite a long time. And, you know, we were able to have conversation about it and just talking with the kids and figuring out how we could somehow meet in the middle. And what they ended up, I guess, negotiating, if you will, as a family, is that they would, this one daughter would have some photos in her, well, it wasn't her only room, she shared it with her sister, but that she would have some photos on her side of the room and keep those for herself. But, you know, it's important to, within a family system, honor each of the kids and what they need. Andy, you can go to the next slide. And one thing I'll mention is you'll hear me using the word adult a lot. We've been talking during this time together today about the importance of language. And I try to be really careful about the use of the word parent. So many kids I've worked with through the years might not have a parent who's living, or might not have a parent who's living with them. And they're very, you know, sensitive about the word parent. It could be very hurtful when everyone's always throwing around the word parent or making assumptions that everyone has parents. So I try to use the word adult quite often when I'm working with a group of kids. This particular activity actually shows a bunch of emotions you can see on a shoe, and we have kids and teens, and this is one of the activities we obviously do in person, where they trace their shoe, and then they cut it out, and they put all kinds of different emotions that they may be feeling or experiencing, and what it's like to be them for a day. And we call this activity Walking in My Grief-Filled Shoes. That's an example of that. But one of the things that we've seen through the years, I'm sure all of you have as well, is that bereaved kids and teens will often act out instead of talking about their emotions or showing their emotions in other ways. I can't tell you how many times I had calls from schools or calls from parents and adults and caregivers saying, you know, they're acting out or they're misbehaving or they got suspended. And we would have a conversation around the child or teen's grief, right? And so many things can be traced right back to grief. Couple more slides here and then we'll open it back up for conversation. Again, I feel like everything on this slide we on this call know. I guess the one thing that I would point out is how often kids get confused when it seems like other people in their life have moved on, and maybe they haven't, and certainly not their immediate family, but other adults in their life, maybe extended relatives, maybe their classmates or their friends, you know, other people in their circle seem like they've just kept going on with their life. And of course, for them, the world has stopped because somebody very important in their life has died. And they are confused by that and very hurt by it. So we spend a lot of time talking about that and what that's like for them. Okay. All right, and this particular activity, you can see a young girl drew a picture of herself, and she's holding up a picture that she drew. And this was actually an activity that we did around how hard it is on Mother's and Father's Day in schools when they make cards for mom or for dad, how hard it is for kids who are grieving, that there's an assumption made that they have somebody at home to give a card to. And that's actually how this particular activity was created. But kids do love to share about the person who died, but they have to, of course, feel safe and feel trust and feel connection. And us creating that safe space is what allows them to share with us if they choose. But they don't always choose to share with us, right? Andy was talking before about grief as a shared experience, and grief is seen and unseen. And one of my favorite quotes is that private grief does not mean absent grief. And so many kids and teens do want to share, but there are equally as many kids who don't want to share. So private grief does not mean lack of grief. It just means they're choosing not to share with you at this point in time. And I think it's so important to normalize and to really assure, adults that kids don't have to talk about it in order to be able to work through it. Talking about it doesn't mean that they'll necessarily, it's not, talking about it isn't some kind of magic formula, right? There's other ways that kids work through grief, but kids often do want to share their story, and our groups allow them the opportunity to do that. And I think one of the things that children want reassurance of is that they know they won't forget the person, but they want that reassurance that no one else will forget their person as well. And then, Andy, let's see, do we want to, maybe we'll talk about some protective factors. We can always come back to that slide in a moment. Or, well, I guess, yeah, well, let's come back to, we can come back to that. We know those protective factors. I'm curious if anybody would like to comment on any of those slides, comment on your experience with kids, on your experience. Well, I'll tell you, one of the biggest challenges in my career, especially I'd say early on, was working with adults around telling their kids the truth. Because they often really fight me. Not now as much. I feel like I was able to work that out. I was able to work it out, I guess, for me, where I was able to figure out my language around letting them know the importance. But early in my career, I think I personally struggled with letting them know the importance. And I'm just wondering how some of you have navigated that for yourselves around the importance of telling the truth and working with families.
I'd like to share. It's Maria.
Hi, Maria.
Hi. Actually, I feel like that's such an important topic too, and also similar to, I'm sorry, that's my dog. Also similar to what April was saying earlier, I think working with kids, one of the important things is learning their language, because it is different from dealing with adults. Mm-hmm. And so I know for me, because initially I never thought I would work with children. I always just wanted to work with adults until I actually started working with children, and love it even more now than working with the adults. But one of the things that I realized was how different the language is with kids, and just learning how to adjust myself instead of thinking about, like, quote unquote, this child is resistant to some help or they don't want to open up. It's more about me as the clinician, how I can change my interventions with the kids. And I know it's been so one of the things that's so challenging and rewarding for me is the fact that, kids come as a package with their parent or their guardian, and doing that work has been so inspiring over the years, because we at Calvary have had so many phone calls from guardians or other family members that will ask us, what do we do? How do we tell the children? I remember one woman that comes to mind called and said, that this 7-year-old had experienced the death of her mom, and the rest of the family didn't want to tell her. And she was like, somehow I know there's something wrong with that. So that's why I reached out to you to see if you can help us. Mm-hmm. And so I think I've found that work really inspiring, and also at the same time, very frustrating. And I think part of my own work as a clinician has been learning how to deal with some of those feelings towards the guardian, because of course I know that there are so many reasons why guardians don't want to tell the kids. But I think one of the things I've struggled with in the past was, not being so angry at the guardian, like, what, you don't want to tell your child, or they already, especially when kids come in and they already know that something has happened that they don't know about. And so they've made up their own stories in their mind. So I think I just wanted to share on that. I feel like it's such an important topic, is the work with the kids. So thanks for bringing it up, Pamela and Andy.
And Maria, you bring up a really good point that I didn't mention. If kids don't know the truth, they will often imagine things far worse than the truth. And that is one thing that I've learned to tell adults and guardians, that do you want them imagining far worse than what actually happened? And kids do find out. And I'll tell you another thing that, and this is something I tell adults as well, back when I was running a center for grieving kids, we would have adults in the adult room in one group, and we would have kids in another room in their group. And the kids knew the entire story. The adults in the concurrent group were saying, oh, kids don't know a thing. Same night. Kids knew all the details, right?
Exactly.
Other thoughts, comments, questions?
I was going to say, I think somehow an important piece of this conversation really is connecting caring adults to kids, and how do we do that? It's the old saying, and I don't remember where I picked it up, but that kids are keen observers, but they're poor interpreters.
Right.
And so kids need the adults in their lives. I mean, I think I mentioned the ACEs study earlier. I can't remember, or was it yesterday in our meeting yesterday? But I mentioned the ACEs study and what it taught us about that one of the protective factors for children who have experienced trauma or loss in their childhood is that relationship is a relationship with at least one adult who they believe cares that they're in the world, right? And so how do we make those connections? Because without the adults in kids' lives, kids are just interpreting whatever they're seeing at the moment. And how many of us carried misinterpretations from our own childhood that we were well grown before we even dealt with, right? Or had impacts on us. And I don't know, to me, somehow there's a piece there.
Yeah, even thinking about John Bowlby, and I know we were talking about John Bowlby yesterday in attachment theory, but having kids hear the truth from the adults or adults in their lives that they're securely attached to and that they trust, right? Versus their cousins or because think about it with cousins. And how did I learn this, you guys? Early in my career, the cousins knew the entire story because the aunts and uncles weren't paying attention to the kids being in the room. So the cousins immediately, long before cell phones, right? They were outside telling their cousins, oh, here's what happened to your dad, right? So, yeah. I'm also looking at the time and realizing that I think we end at 1 o'clock Central, 2 o'clock Eastern, correct? This time, I don't know about you guys, but for a 4-hour Zoom, it goes pretty quickly. Want to see if there's any other questions about kids. Lauren, did you want to add anything? Or Michaela from Willow House?
Yeah, I do. So I've been working with kids most of my time in the bereavement field, and I love that modeling aspect of playing with them in the setting, in the session. I am drawn to working with kids because we get to play with them, we get to laugh at them, we get to make the silly faces and move around. And I really like taking that and showing them how they can be grieving and having such a hard, devastating emotion, but take it and still be able to find these positives. And I think a lot about one of my first clients I had. He lost his brother to cancer, and I'm an art therapist, and so mom was very apprehensive about him coming to do art and using that as the expression. But it really allowed me to, while working with her son, and then with his permission after the session, to show her how much he was gaining through the creativity and play. And so then you talking about connecting them with their parents and just bringing in that psychoeducation for them of, why play and creativity is so important. So yeah, just finding moments to let them laugh and have that safe place of play is so beneficial. Things that we can bring to their grieving process.
Absolutely. I always say, who needs fun more than grieving kids? I mean, as far as what we can actually bring to them. I know it's harder in Zoom, I realize that, but whether it's in our groups or if we're, you know, running a camp, with our camp, we tried to have as much fun as we did grief related activities. And it was kind of highs and lows. But to me, there's nothing better than to see grieving kids and teens playing, you know, a fun game together and being able to just laugh, because they don't really have permission, if you will, to be able to belly laugh the way we would want them to have those opportunities in the rest of their life. And certainly not now with everything going on.
I earlier this week, I was facilitating a parenting care group. One of the other organizations I work with is TAPS. I'm their senior advisor to youth programs and young adult programs. And so we do a parenting care group once a month for parents just to get on and talk about what it means to parent their kids who are grieving. And the conversation this past week it was very interesting, because it was about the parents that were on there were struggling with, how do I get my kid to talk to me about their grief? I'm so worried. They won't even tell me what they're thinking, and it worries me that somehow they're not thinking right and it's going to come back to get them. And the conversation really shifted to what if, because they were saying, I do it, and I just fail and I fail and I fail. And so we said, well, what might be a different way to approach it? If what you're doing isn't getting the results, what's a different way to approach your child? And conversation ended up being about, how can you be with your child in ways that your child prefers? Yeah. And that's true of your teenager. So it's a different way of looking at the relationship, rather than, I'm your parent and you need to tell me how you're doing so I can make sure you're okay. It really became more, don't sit in front of them, sit next to them and join them in what is it that they're doing in that moment, and who are they, and what's their temperament, and what means things to them. And so it was interesting. One of the mothers, she said, okay, well, I'm going to try it this week. I'm going to sit next to my daughter and I'm going to watch YouTube with her, because that's what she does. She watches YouTube. But it is that point of, even as parents, it's our instinct as parents to correct and to make sure they're okay, as opposed to just being with them. And I'm not saying that we shouldn't be parents, because they need us to be parents in their life, right? But how the relationship between us can also be built on that, on being next to each other and participating together in something.
Andy, I just wanted to add something, just exactly what you're talking about. Something that I've done with the parents that I worked with is introduce all of that, but then teach them reflective play, of modeling that, of how do you do that. And I even do that with adults or teens, that reflective, just to companion them, be next to them, and be doing the same activity they are. And I'm not sitting there badgering questions. I'm just sitting there, like, if they're coloring, I'm going to sit there and color. And then maybe they'll ask me, like, what are you drawing? And I'll tell them, I'm like, what are you drawing? And building that rapport. So like you said, I'm joining their world at their pace. And then oftentimes I find that they just start saying stuff that you would not imagine that they are sharing or they're concerned about. And the parents are always amazed at that, but giving them that skill and teaching them how to just sit there and engage with their child without having the expectations that the child speaks like they would speak to a therapist, like an adult talks to a therapist. Just kind of understand that.
Yeah, I agree. Thank you for sharing that, Carrie. Actually, one of the things, so Willow House has a couple of pieces that Pamela and I put together that will be made available. And one of them is a family engagement guide. And it's all sorts of information for parents on their kids and during COVID and how do we connect, and there's activity ideas. It's really a parent-child thing. And we actually included a section in there on child-directed play and teaching parents. And it was interesting, my wife was reading through it and she came to me and she said, do you think this might be a little condescending to parents? Do they not really know how to be with their kids? And I said, I have to tell you, I would kind of agree. If I read it, I might be like, well, yeah, I can, let my child lead. But there's not a manual. People don't get a manual when the child comes into their life, right? And you have this child, and who knows what other stresses are going on in a person's life, and particularly if the parent's grieving too. Sometimes even if they do know, to have that reminder that it becomes self-defeating as a parent when we're just asking and asking and asking, and all we get is, yeah, I don't know, shoulder shrugs, right? It becomes so frustrating that, to me, a gift we can give to parents as people who work with kids is to let them in on the secret, right? Parents used to say to me, they'd say, what'd you do in there with them? Like, how did you get all that information? They would say, first of all, I'd say, well, I'm not their parent. That's one way I got it.
Right.
I don't have all the relationships. But I just told them, well, I can tell you what I do, and you can use it if you want to. So it's like, let them in on the secret of how we get information from kids. We just follow in their play, right?
And when you think about it, centers across the country use active listening and reflective listening, and we train our staff and our facilitators in that, right? People do, they'll say, what, how are you getting a whole group of 12 or 14 kids to open up and talk? How are you getting teens to talk? And reflection and not making assumptions about them or their experience. Yeah.
So those are a couple of resources that will be out there. They'll be free, downloadable. You can distribute those, use those with families as you would like. We also have one we created on grief and COVID, and it just talks about COVID and the impact of COVID and how to deal with the stress in our lives as a result of it. So it's kind of like, it's the other piece to what we've talked about today, all the stressors and all those things, helping families to understand how can we endure this? What are some coping mechanisms and coping skills we can use to endure through this experience that we're all living through? So those are certainly available to us. I wonder, as we have just a few minutes left, if we could pivot for just a second. And anytime we have a talk where it's this lengthy a talk, right, and this in depth and what we're all talking about, and I know we talked about at the beginning, I think about the statements that so many of us in healthcare are operating in crisis mode, right? Like, we're operating that way, that it's hard to even think about how do we cope and how do we input coping and self-care into our lives. But we would be remiss if we before we were off of this talk didn't at least breach the topic of self-care. And we would like to just leave you all with a tool. Now, those who were on with us yesterday, you've heard this. I'm going to do the same thing I did yesterday, because when I talk about self-care, I've been in lots of talks where people tell me how to care for myself. And the whole time I'm sitting there going, yep, I don't do that. I don't do that either. And or that doesn't work for me. It may work for you. So what I'm not going to do is go rattle off a list of things you need to do. Okay. But what I do want to leave you with is a tool that I use in my own life from time to time when I'm starting to feel like I need to evaluate what I am doing and what I'm not doing and all of those things. And so it's just 4 questions.
Andy, will you pull the slide up? Because
yeah.
I think it's good to hear it, but I also enjoy reading things.
Yeah.
For anybody who likes to read things.
Yeah, we can do that. So
and while Andy's pulling that up again, there is some content in the slides that we didn't cover because it was more important to us to have the conversations that we had. So we knew that there would be certain slides we wouldn't necessarily get to, but you'll still have all the slides afterwards.
So these are just some questions. And again, you'll have this slide, but these are some questions we would like to leave you just to think through your own self-care and your own plan of action. I call this a self-care strategic plan, really. And so just the questions very quickly. When it comes to your personal health, what are you doing well that you should keep doing? You say, I'm already doing these things and it works for me and I'm going to keep doing these things. When it comes to your personal health, why are you not doing? What are you not doing that maybe you say, I need to start doing. You think through what are those things. And the third question, when it comes to your personal health, what are you doing that you need to, what are you doing that you need to stop doing? Because sometimes there's things that we're doing that are counter to our good health, right? And then the last question really is sort of like a little extra bonus question. And that is, when it comes to your answers to the questions above, what is it that is preventing you from implementing these items into your current life? And it could be the situation, time, resources, money. It could be a lot of different things. But sometimes identifying what is prohibiting us from doing it allows us to create strategies for dealing with what's blocking it. Because sometimes it's not just starting it, it's I need a strategy or a plan that will address the issue that's keeping me from doing these things, if that makes any sense. So we just wanted to leave that and leave you with the thought of the things that we certainly can do in our own lives for our own care, and how important that is, so that we can endure and we can be here, and particularly for, like we talked about, some of the consequences that are going to be a result of COVID. And it's kind of like we're on deck, you know, and we need to be ready and prepared and available for the people who will need us along the way. I'm going to turn it over to Lauren. And in doing that, I just thank you so much, everyone. It's been a pleasure to spend the day with you. And it seems like it's gone by fast on my end. I don't know about your end, but I appreciate the conversation and the dialogue and the perspective. And to me, conversations are the start. And now we turn around and we implement and we put action, put our words into action. And I am proud to serve along the side of each of you as we do those things together as a community.
And I agree with Andy. It was great being with all of you today, and good to see some friends, and great to meet people that we've met for the first time today. And I can't wait for our paths to cross again. Hope to see you in the future, either on a Zoom or at a conference, maybe ADEC or the symposium. And certainly reach out to Willow House if you have any questions about grieving kids. And thank you again. Lauren?
Thank you so much, Pamela and Andy. Something I realized I didn't say at the very beginning, just because we have people from all states, is that, in case you don't know, Willow House is in Illinois. We are located in a northern suburb, Bannockburn, Illinois, but we do serve Chicago, Libertyville, and Arlington Heights, and we work with schools and community organizations throughout the state. But just wanted to put that out there in case any of you guys are local, or even if from New York and know of a family that needs referrals in Illinois. So that is where Willow House is located. I thank you guys so much for joining us. This is our last seminar that we have hosted. And so it's just such a lovely way to round it all out with you guys. And I've enjoyed the chat and the conversations that we've had, and seeing all of your smiling faces and engagement. So thank you. And I do want to point out, I saw a question about the slides. When this ends, you will receive an email from CEGO, and that is going to send you a link to a CEGO dashboard. And in there, you can take the survey, which we would really appreciate any feedback. You'll get a link once the survey is completed for a CE certificate if you need those. And that in that dashboard, it'll also provide you with the PDF form of the PowerPoint. And Michaela, is there anything else that gets included on that dashboard for them? Okay. So you will have the PowerPoint through that dashboard. But yes, I'm going to also put our general email for Willow House. Please reach out with any questions.
And then when those other two resources come out, because you're already in contact with Willow House, you'll be on the list to hear about those or to receive them, correct, Lauren?
Yes. Absolutely. And you can also, if you want, you can sign up for our newsletters through the website as well. So thank you all, and I hope you have a warm, relaxing rest of your day.
Thanks, everyone.
Thank you, everyone. Thank you for spending time with us.
With us.
Bye.